Oh.
Yeah, which requires
What's up?
nothing.
Go and go.
I don't know.
It'll be busy tonight, huh?
Yeah, well, a couple miles should take long.
Has anyone seen Glenn? I know he was in the room, but
Who?
Glenn?
Yeah, well, he was in the room. I don't know.
He was with Diana.
No, Diana's right
I
there.
have here.
Oh, I didn't see her, I'm sorry, no, I don't know.
He's committed first step.
Oh,
Is that who all the guys are in the suits?
Caucus.
Is that who all the guys are in the suits?
They were caucusing.
Here he goes.
Please proceed. Appreciate you waiting.
Welcome to Kent County Levy Court's Tuesday, October 5th, 2021 committee meetings. We have all 7 commissioners here and the county administrator. And before we start with our committee meetings, we'll have the county administrator explain how calling in works on the phone.
Thank you, President Pepper. This meeting of the Levy Court is being held at 555 Bay Road in Dover, and we are also broadcasting via WebEx the meeting to guests who may be joining over the internet. And for their benefit, we ask that all speakers state your name prior to your comments so that our guests know who is speaking. And for the guests also, throughout the meeting, at the end of each committee, there's opportunity for public comment. If any of our guests, either in the room or on the internet, wish to address Levy Court, they'll have an opportunity to do so. And we typically would request guests in the room to address Levy Court from one of the podiums in the room, and then followed by our guests who may be joining us via WebEx who wish to provide comment. And they would be able to do so after unmuting themselves. We could also raise their electronic hand. If they're on a phone, it's *3. And of course, on a desktop or laptop, there's a graphic icon that you select for to raise your hand, and our operator would be able to bring you into the meeting room at that time. As a duly advertised committee meeting of Levy Court, all the rules of procedure that apply to committee meetings are in effect, including the Mason's Rules of Order. Mr. President, back to you. Thank you.
Thank you. At this time, we'll open the committee meetings. First one is Public Works. Mr. Howe, turn it over to you, sir.
Thank you, Mr. President. Mike, I believe you probably are the best one to elaborate on this. Would you like to spill the beans?
Sure. Thank you, Commissioner Howe. We have before you a request for a lease renewal for the property known as Triumpho Farm, which is located on the northerly side of Delaware Route 12, Mid-State Road, just west of Frederica. And it's been under lease for the past 5 years to Mr. Henry Medding for the purposes of rights to hunt the property. And Mr. Medding recently contacted me via letter requesting reconsideration of the lease, which is due to expire July 1st of next year. And well in advance of that expiration date, Mr. Medding is requesting a 5-year renewal on the lease, which would take it out to June 30th, 2027. The memo that I provided to you in your packet includes the letter that I received from Mr. Medding, along with a recommended motion in support of the request if Levy Court so chooses to renew the lease. Also, I see that Mr. Medding is present tonight. If he has anything to add, he's certainly welcome to come on down to the table and address the commissioners if you wish, Mr. Medding. Okay, he's suggesting he's okay back there. Mr. President, I will turn the floor back to Chairman Howe at this time. Thank you.
Thank you, Mike. The request before us is pretty simple, straightforward. It's a 5-year term, July 1st, 2022 to June 30th, 2027, $6,375 a year. What are your comments? Any objections, problems, questions? Yes.
Mr. Medding's been a great caretaker of that piece of property.
Mm-hmm.
You know, he keeps it up, maintains it, and has, like I said, done a really good job.
Yeah, well, that's good to hear. All right, we want to pass this on to the consent agenda. 7 up.
Okay.
Are there any comments on this particular issue in the audience? Don't see any, don't hear any.
Anyone on WebEx wish to address this particular matter before Levy Court? Press *3 and bring you into the room.
I see no hands raised at this time.
Very good. Mr. President, back to you.
Thank you. That concludes the Public Works Committee. We'll move on to the Public Safety Committee, and Mr. Hall, as chair, turn to you, sir.
Mr. President, ask Chief Faulkner to come down and talk to us about this lease.
Thank you, and good evening, Commissioners. Commissioners, it's time, 3 years into our lease for a lease renewal for our Frederica site. This is for our southwest unit that we have in Kent County, and there is actually literally no change in the lease other than the dates. The monthly obligation fiscally is the same as it has been for the last 3 years, which is almost unheard of nowadays, but they have not raised any cost for us. That site works very well for us. It lets us penetrate a good part of the county very well, just as it was intended to do. So the Department of Public Safety certainly recommends that the commissioners approve extending the lease for another 3 years.
All right. Chief, any questions at all for Chief Faulkner?
Just a comment. From what I understand and what I see, it looks like it's a good marriage between the county and Frederica Fire Company.
Couldn't be any better.
Yeah, that's what I understand. So it's a great location, so sounds good to me.
Chief, has there been a, forgive me, didn't hear what you said, Lisa. There is no present request to increase the number?
No.
All right. Is that common? In other words, have our other arrangements held the line also? For example,
Yeah, the obligations that we both have to each other at that site has been consistently very good over the 3 years. Actually, I don't hear anything from them, which is always good.
it's not an issue, more of just a thought and maybe something to consider. They've had a good relationship where they haven't asked for any sort of increase. I was curious if there was any type of costs associated over the years that they haven't asked us to build in. So maybe that's something we could check on.
So there was discussion amongst the members of I guess the leadership
Okay.
of Frederica on, as it was characterized to me, over the possibility of raising at least maybe $100 or so to, I think that was the sum, to address utility elevations. And quite frankly, and I dispelled this as soon as I heard it, but there was a thought that if they did that, we may want to leave the site, which I said that's absolutely not true. We would never do that. So, but it was elected by the board of directors from Frederica to leave it as it is after they had discussed that.
Just that, not to beleaguer, just to have the thought process. We benefit greatly from the relationship, right? We know that. We want to pay our fair share, which I think we do. What we don't want is our host to make financial decisions somewhat out of a concern that it might upset us. If it's a fair ask, a logical ask, I would encourage their leadership to ask. And maybe that's something, if we needed to, we could revisit in the middle of this. Is that fair? Or is that not a possibility?
Well, I think it's certainly fair and possible. When I discussed this with the leadership, at least the one individual, Steve White, I said this would never happen. The county would never do this over an increase. This is a good relationship that we have, and they don't want to. We want the relationship to remain good and perhaps not stressed by inequities in their fiscal obligation to the site. So, but nonetheless, they did discuss it, and they decided to leave it as it was.
All right, thanks for your time.
Okay.
Any other questions? All right, move this forward to consent agenda.
Thank you.
Any questions in the audience or on WebEx?
I see no hands raised on WebEx at this time.
Back to you, Mr. President.
Thank you. Moving on to the Administration Committee, Mr. Angel, Chair, turn it over to you, sir.
Thank you, Mr. President. If I could have Ms. Graham come forth, please, and just give us a little description of the homeless socks that she put out for. Ms. Graham, you want to make a quick statement, please? Again.
Hello, good evening, Commissioners. Hi.
So tell us how you did this and what you got and what you received and how long did it take?
Well, Kelly had put out an email about the Healing Heals program that was going on, and the night before I'd seen a commercial on TV for Bombas socks and how they have a donation program. Each pair of socks that is sold, they donate a pair. So I just happened to pop on the website and see what the donation process was, and it was basically just filling out a little form, which I copied Kelly's email, the information from the email, and sent the form in. And I'd say about 2 weeks later, a giant box of socks arrived at the building. So that was basically it. And then in return, they just asked, if we could send any pictures or anything showing that we donated the socks to the organization.
Right.
That's my understanding. There's a year-long backlog. We got them how long?
In about 2 weeks.
Wow.
That was great.
Mm-hmm.
Yeah.
So,
Wow.
Yay.
Thanks for taking the initiative.
I was
Yes.
very happy to help. And
Thank you.
Thank you.
any questions for Ms. Graham?
Turn your mic on. Any questions?
Jennifer, where are they located? Bombas?
I'm not really sure. Kelly, was there any paperwork? I believe it might be California, but don't hold me to that.
Any other questions? for-
Al, you don't have to push the button.
Okay, any other questions? Kelly, we have somebody here to receive the socks, correct? Okay. That's First State Community Action Agency. If they can come forth, please, and please.
It stays on by itself.
Yeah,
It's got a mind.
it's new. We haven't been doing it long, maybe
Hey.
20 years.
It wasn't on.
Don't want to rush it.
Are we?
Oh, shucks. How's this work? Yeah, I don't know. Somebody take control. Come on, Angel.
Ms. Kelly. Good lining up, everybody.
So we wanted,
Kelly?
Yes.
Levy Court to know that we were gonna do outreach. And if I could just share this home real quick.
Okay.
We have outreach bags for homeless. So inside it, we put some toilet paper, some home items, some food, toilet paper, toothpaste, brush, essentials. And of course, we'll now be able to put socks in it and hand that out to them.
Great.
Hi, I'm Bernice Edwards, and I'm the Executive Director of First State Community Action Agency. And at this time, I would just like to thank Levy Court and 911 for providing First States with the socks, because as we work with the homeless throughout Kent County, this will be a godsend for them because it's getting cold and they're going to need that. So again, thank you for allowing First State Community Action Agency to be your partner in this. Thank you so much.
Thank you. No, thank you. And for those who don't know, homeless, which I've been helping for the last 7 or 8 years, the number one request is socks. Because once their feet gets wet and cold, that does just about anybody in. So it is greatly appreciated, and the extra bag that's going to go along is definitely going to be appreciated, and we thank you. Do we want to get a picture with First State?
Yes.
Okay, Kelly, you line us up.
Okay, can we line up somewhere around the box?
Certainly.
You get the players in first and we'll work around you.
Well, we'd like,
Anybody?
we'd like the player that made the call.
There you go. He's the important one right
Come
now.
in.
Yeah, make it happen. You guys go in first and we'll work around you.
Great job.
Hey, you guys stand in the back.
You got the important people in front right there.
Yeah, I didn't want the table, but
County Commissioner? Or County?
Commissioner Hall.
Oh, you gotta come forward. Mr. Benamon?
I still can't see you, Commissioner Hall. Thank you.
You get the socks?
I did get the socks. You know, I just want to.
That'd be funny.
These socks are made differently from the other. The people wear their feet and
Not my side.
no, they're not your socks.
Okay. Here, we gotta get all this stuff away.
Going somewhere or just over here?
I was looking to escape with it, so tomorrow we can start taking all of our bags.
Well, let's go. They'll be glad I'm going anyway.
Point. Okay. That's a gift for being late. Okay, Bay Health Graduate Medical Education Program presentation. We need more chairs.
New York, okay.
A couple of them sitting right behind you there.
You should do something like that in Smyrna. I'm going to give information to Carol.
Yeah. Good evening, Commissioners and County Administrator Pettit-Damage. On behalf of Bay Health, I would like to thank you very much for this opportunity to present what is, in my opinion, and as it relates to my service as a member of the board, arguably the most significant thing that the hospital has undertaken. As we reflect on the pandemic and as we continue to work through it, I think one of the key takeaways is the importance of access to health care. And our community is like many other communities in this country, where there is an absence, a lacking, if you will, of available primary care, particularly primary care professionals. And it's why I, as board chair, am just so thrilled with Bay Health's work in developing graduate medical education. So tonight you're going to hear graduate medical education. You're going to hear about how Bay Health and the excellent healthcare workers continue to work through the pandemic, and it's just I think a really remarkable thing for our community. So it's my pleasure to introduce our longtime CEO, Terry Murphy.
Thank you, Bill. Longtime CEO. I don't know if that's a good thing or a bad thing, but I'd like to thank the commissioners and County Administrator Pei Dimage as well for having us tonight. We really do appreciate it. A lot of people talk about new hospitals and buildings, but really when we began looking at what we needed to do to really prepare for the health of this community down the road, we thought about doing graduate medical education, and I'm not really interested in not doing it well. So we engaged particular groups of individuals that would make sure that as we built this program, we did it right. And I think you'll see tonight with our program directors that are all part of the Bay Health team now, we've gotten individuals that are leading the newest physicians coming out, some really bright individuals that it really is a special program. And the one thing that Bill mentioned that is so true is the pandemic has just created all kinds of crush and stress for those that are in healthcare. And it's not just the COVID patients, people putting off things in a county that was underserved to begin with as it relates to physician to population ratio. So it is really, as we became a teaching hospital accredited by the Accreditation Council for Graduate Medical Education, the first and only in Kent and Sussex County, it is really a special moment to be considered a teaching hospital. And I'm going to lead off by introducing Brintha Vasikar, our family medicine program director, who I believe recruited out of the Medical University of South Carolina. And she will introduce her component of the program. But in the long term, this program will produce over 100 physicians coming out of residency in our community. And our hopes is many of those physicians will continue to stay in our community. So thank you for your time tonight. Appreciate it. Thank you.
Really cool.
Thank you so much for having us tonight. I'm Brintha Vasikar. I'm first and foremost a family doc. That's how I describe myself even in my normal life. I'm originally from Philadelphia, but I've really made my career working in communities that needed a little help connecting patients, people in the population, to the healthcare that they needed. And so that's what drew me here to Delaware. I'm not originally from here. I don't have roots here in the state, but I'm sure glad that I'm here. Now, you all know, you've heard from everyone in this community how difficult it is to find a doc here. And that's in great part because we are what we call a health professional shortage area. There's less than one physician for every 2,000 people. So you can imagine how difficult it is when you're calling around trying to find an opening to find someone who has that availability. You add to that the undercurrent of how physicians choose where they live. Usually it's because they have a tie to a community. Delaware is one of, I think, 3 states now, because Montana just now getting a medical school. Delaware is one of very few states that doesn't have a medical school at all. People like staying where they know, where they're familiar, where they have roots, where they have experiences and people that they've connected with. And without a medical school here, and we can't really choose where people grow up, our next step was how can we get people here for their residency so that they get those medical experiences early in their careers and want to stay here long term. In family medicine in particular, there's some great data that shows family docs in particular tend to stay within 100 miles of where they train. More than half of them tend to stay where they train. And that was really the heart and soul and plan behind why we needed graduate medical education here in Kent and Sussex counties. Now, Newcastle County does have some graduate medical education, but here at Bay Health, we are the very first residency program in Kent or Sussex counties. So let's rewind a little bit and talk about how a medical student becomes a doctor. So it starts with 4 years of undergraduate education, followed by 4 years of medical school. So they have tons and tons of training under their belt before they come to us for their 3 to 5 years of residency. During residency, they train under a certified physician, one of us, one of our many partners at Bay Health, who have been out in practice for a number of years so that they can really take excellent care of our families. They are capable, they have all the book knowledge, but now we want them to get the hands-on skills, see as many patients as possible so that we trust their clinical decision-making before we let them fly out on their own. Family medicine is a 3-year program after medical school, and here at Bay Health we have 8 residents in each year, and when we're fully up and running, that means 24 residents. That's huge for family medicine, and that's by intent because we knew how much primary care was needed here. And again, it's this pipeline process to bring more doctors here to stay. Family docs do a little bit of everything, and this is a little bit of a new concept in this area. Family docs haven't traditionally done everything, but we do from birth to death and everything in between. We deliver babies, we take care of newborns, we hold hands during end-of-life decisions, and we're there in the inpatient side, on the outpatient side, whatever you need, your family doc. We want to bring back the old-fashioned family doc that does home visits and nursing home visits and is part of your family. So here at Bay Health, as Mr. Murphy alluded to, we don't like to do anything repeated. We don't like to do anything just because it meets the minimum standards. We really wanted to do something amazing and outstanding. And for us in family medicine, that was how can we connect to meet the needs of this specific community? And we very quickly realized there were so many different pockets of underserved groups that we wanted our residents to get involved with all of them. We wanted them to find their passion project, to say, I'm only here for 3 years, but let me figure out what this community needs and really put some extra effort into that. Our residents are all required to do research, project improvement around quality and safety during their residency. And sometimes that's something a little bit easy, like how can we improve hand washing rates? And sometimes it's something more robust, like we have a free clinic that doesn't have very many resources. How can we connect physicians who want to volunteer to the people that need help? And so we're hoping that by connecting to the community very early on, we're building that social capital so that our residents want to do those sorts of projects that impact real people in a real way within 3 years that they're here. And hopefully longer, but at least during those 3 years. The heart and soul of family medicine is our outpatient practice. This has been our pride and joy. If you've been over to 1074 South State Street, you know that we just launched in June of 2021. Our goal was to be full in the beginning, and we knew how much the need would be, and we have been very, very full. It's a good problem to have. We anticipated seeing X number of patients in our first month, and we saw triple that amount. That's how much the need is here, and we are happy to continue to grow into that space to be able to meet that need. Very large practice, 24 exam rooms, it has educational spaces for the residents, but it also has all of the connectivity and top-of-the-line medical care, medical equipment that we need to provide excellent care. So for example, telemedicine has been such an important part of how we practice this year with COVID, more so than ever before, and every one of our rooms is connected so that we can have that sort of care provided. We also looked at what the top 2 healthcare trends were in the state of Delaware, and the biggest needs in 2019 were around addiction and mental health. So being who we are, we thought, how can we meet those 2 things head on? What can we do to improve those 2 things? So one, we have a behavioral health counselor embedded right within our practice. So we can do warm handoffs, we can do share care. It's not just about the physician in our practice, it's about how can we provide excellent care as a team. We also have a pharmacist that's part of our care team. So if somebody's on 37 medicines and isn't quite sure what they're taking when or why, we can try to get them off of some of those medicines. Again, best practice, keep them out of the hospitals, keep them healthy and with their families. The other thing we did with addiction is, given Delaware's strong overdose rate over the past few years, all of our residents are trained to do medication-assisted therapy. We want to do our part to treat all patients, regardless of their diagnoses. With this practice, are you trying to ask me a question? Sorry, please.
Mr. Buxton?
When you're finished, before you leave that slide, that's all.
Oh, yeah.
You're finished and leaving the slide, and then I'll jump in.
I am almost on the slide, but you can, okay, so at full capacity, we anticipate that this practice will add over 30,000 new visits a year to this area. And as I mentioned, we're sort of exceeding our plans so far, so we're hoping that it's even more than that. Okay.
Can you go to the previous screen?
Absolutely.
Okay, I'm gonna show you.
So we have a number of community partners. This has changed some with COVID and some of the limitations around who's willing to have residents during this time.
Then go to the next page, because I want to articulate what I just saw. This facility exists today and can be accessed by whom? Like, is it urgent care, walk in the door, or is it my own doctor sends me there?
It is a family medicine practice, so you can call and make an appointment as a new patient.
New patient.
Correct, and we're happy to see you. Or if you are dissatisfied with your current care, haven't been able to get in to see your own doctor, we're accepting new patients.
So I'm a county commissioner, which makes me really not much of anything other than you would think I would know that.
Yes.
Here's what I do think I know. I do think I know that I have a 22 and a 21-year-old who I can't find them primary care.
Come see us.
Right, so they use the doc in the box. Nothing wrong with that, but I'd like to get them something more concrete.
Yes.
So that's the plan, right?
Correct.
They go over there.
Yep, and all ages, which is the beauty of it. So if you're a single mom with 2 kids and it's really difficult to get an appointment because who's gonna watch the kids, you can have all 3 appointments at the same time.
And that's, how long has it been open?
2 months. 3 months? 3 months now.
It's interesting. It's great.
Yeah.
Interesting. Clearly I haven't been paying attention, have I? It's not bad.
And it is the old CNMRI building on
State Street.
That's great. Thank you.
Yes.
So along, if there is somebody who already has a primary care physician, unfortunately their primary care physician is out of state.
Yes.
By the time they need to go see somebody, they have to drive to Chestertown, and then that'd be perfect for them.
Correct, correct. Our most common people are folks that have moved to the state and have just had an impossible time finding someone. So we're happy to fill that need, but certainly with our focus on obstetrics and babies, we're getting a lot of young mothers as well.
Can I request something you probably already advertised, something sent to my email, identifying that facility?
Absolutely.
Yeah.
Lindsay
And again,
can
I'm not
get you all that.
Or how to contact them or something?
I'm sorry?
How to contact them? How do they call?
Oh, yep, there's a phone number and they can call and make an appointment.
Okay.
Thanks.
Yep. I'll be very honest, there is a waiting list. That is how much this is needed in our community, but we are doing our best to get everyone in within a few weeks.
Sure. Fine, thanks.
Mr. Masson?
Realizing everything in Kent County is close, is there any intent to expand this to like the Smyrna Clayton area where there's a tremendous need for primary care doctors?
I would love to, but I think where we are right now, to meet the requirements of a residency education, we need one facility. So for now, that's where we are, but as we think about years into the future, 24 residents over 3 years, right? So as they start to graduate, and we start having more docs wanting to stay in the state, knowing the state, being familiar with the resources here and the people here, and wanting to keep their own patients, I'm sure a patient from Dover would be happy to drive up to Smyrna to see the same doctor that they've been seeing for 3 years. So hopefully we will retain many of those physicians and be able to build some new facilities and keep expanding primary care.
Okay, thank you.
Thank you.
Anybody else? Can you go back one slide, please?
Of course.
What are you doing with the Veterans Home?
So to be completely frank, the Veterans Home has had some changes in staffing due to COVID.
We're very aware of it.
So with that, we do have a letter of agreement with them, but we have not moved forward with that at this time. I would love to strike up another conversation with them. I think their mission to service stands in alignment with our mission to service and what we want for our residents. So certainly if you have any thoughts on that, I would be very open.
I have to do it offline with you.
That sounds great.
So, and I'll be glad to leave my card.
I appreciate it.
Okay, thank you.
All right, well, that was it for family medicine. Thank you so much. And with that, I'm going to pass it on to Dr. Deutsch, our internal medicine program director, who can tell you more about how internal medicine is lending itself to expanding care here in Kent County.
Thank you.
Thank you.
Thanks everyone for having me as part of the Bay Health team. Hold on one second. Different than Dr. Vasigar, I do have roots in the state. I was born and raised in Wilmington. My whole career actually was in Newcastle County. I worked for Christiana Care. And the only reason I left Christiana Care was the opportunity to start a new residency program in the state that I was born and grew up in. The opportunity to start a new residency program in Delaware and meet the need of our community is extremely exciting for someone who's interested in educating young and bright physicians. So when Bay Health had the opportunity to start something new, I really wanted to be a part of it. I've been with Bay Health now since March of 2020. I came down right around the same time we went into shutdown. I was not responsible for that, I promise. But that is my career at Bay Health. It has been during the pandemic exclusively. And I'm going to switch gears a little bit and talk a little bit about how residents can make a difference on the inpatient setting and how they can improve care as Mr. Murphy and Mr. Strickland have said, as the hospital really has met a surge. So internal medicine residency training, an internal medicine physician after graduation from residency training can fill a lot of different roles. That can include a primary care physician. It can also include a physician really more based at the hospital, what we call a hospitalist. I know not the most inventive term, but descriptive. There are also physicians who will go on to additional training, what's called fellowship training. So they are your cardiologists, pulmonologists, cancer doctors. They really fill a lot of roles in healthcare. So a very important group of people to be training here in Kent County at Bay Health. Let's talk about the inpatient service. I don't know if anyone of you has attempted to go to the hospital recently, but if you have, you realized even just driving by that it's busy. The hospital has been stretched to its limits, and probably even beyond, physicians included. As I mentioned, internal medicine physicians, part of their role after graduation is to become a hospitalist. Our hospitalists at Bay Health, they've been pushed beyond anything they've been pushed by before, by this pandemic, and as Mr. Murphy alluded to, not just the pandemic. People are putting off things. They didn't come to the hospital last year. Now things that should have been dealt with 6 months or a year ago we're dealing with now, and that's not good for our community and certainly not good for our physicians. We need more of them. Our physicians are being pushed and they need reinforcements. We've already mentioned this was already a physician shortage area. When you deal with a shortage area and then have a surge of COVID, it certainly doesn't make anything any better. It certainly has not. The great thing about graduate medical education is that it's really an avenue to recruit people into your community. We're recruiting residents. You have the listing of them. They started a few months ago. But this is just the sort of tip of the iceberg. These are the people who are just starting and already making an impact, as Dr. Vasigar alluded to. But these are people we're hoping are going to stay here not just for years, but for decades, and are people that are going to be part of this community as physicians. People are going to be taking care of all of us and our children and grandchildren. So, as we look at the inpatient setting, this is where the surges really hit us the hardest, both in the emergency department as well as in the main part of the hospital, and getting more physicians in these roles just now, because our residents all work in the hospital, so that leads to being able to see more patients more efficiently. But as this group graduates from their educational training, we're hoping they're going to stay in this community and continue to serve it.
Commissioner Sweeney?
So real quick, I apologize for interrupting. Is this a a build it and they will come scenario, or are there hospitalists waiting to come to Delaware?
Well, I like the analogy. I would say that I think it is a degree of build it and they will come is appropriate, because it's not like, you know, this community hasn't been putting out there that we need more physicians. It's what would draw the physician to come here. And one of those things is the opportunity to train residents. So when a physician is looking at jobs in this region or around the country, something that's going to attract them is the opportunity to train the people who are going to be, you know, physicians of the future. That's an appealing part of a job. So, you know, if we have someone who we're interviewing for Bay Health, it's going to be much more attractive for them to take that position, because they get the opportunity to work with internal medicine residents, family medicine residents, surgical residents, et cetera. So yes, this is a draw for them. And then on the resident side, yeah, if we build this and we have residents here, their chances of continuing to want to work here in the future are much higher than if they had trained in Virginia, let's say, and we're trying to attract them to come work in Delaware. It's going to be a much easier sell for them to come work in Delaware if they trained in Delaware. So it kind of works in two different directions to help increase our physician population.
Perfect. Thank you.
Mm-hmm. We have a second office open. Dr. Vasagar talked about the office in Dover. The internal medicine residency training also involves an outpatient component. Originally, me and Dr. Vasagar both talked about opening 2 offices here in Dover. And then I thought about it, you know, we have a greater need. It was mentioned there's a need in Smyrna. There's also a need in Milford. Frankly, there's a need throughout the state. And the opportunity to open a second practice, ours located in Milford, we felt like would be the opportunity to help a second large population in Kent County. Our practice, just as Dr. Vasagar had mentioned, we anticipate adding a significant number of community visits over time as our practice grows. We're estimating it's going to be 20,000 additional outpatient visits per year that basically this community is not currently getting. And I'll just reiterate, until I got here, I mean, Newcastle County has its areas that are short of physicians as well, especially Wilmington. It doesn't compare to what people in this community are experiencing. When we opened our doors and started talking to people and realizing they have not seen a primary care physician in years, yet have needed to, just because they can't find one or can't get into one because everywhere they call is not accepting new patients. Our practice and Dr. Vasagar's practice on day one could say, we're accepting new patients, we're welcoming you, you know, we want you here, we can see you. And that alone is a big difference.
Mr. Buckland? The same type of access, primary care?
Mm-hmm.
All right.
That's correct. So our office is located on 804 North DuPont, 113 in Milford. And we opened in last week of June. So again, have been open for about 3 months.
Sounds good.
Dr. Joe, it's my understanding that when somebody goes to the hospital and they're seeing the emergency room, the emergency room then tries to find somebody to help them, and that's overloading our emergency room because we're not getting the proper care.
That's correct.
Okay.
And you know, even, you know, the urgent care network that was mentioned earlier, sort of the doc in the box network, does meet a need, but it is not meeting the need in the same way that a primary care physician would meet it. So, you know, this is just such a better form of healthcare for people on a continuous basis.
My daughter's 22. You've heard these stories. She's 22. She maxed out at Dr. Kaza, which was her pediatrician.
Mm-hmm.
Was jettisoned off. We couldn't find a place, couldn't find a home. My 21-year-old, same thing. I think you know what I'm saying.
Mm-hmm.
Just reiterating what you're saying.
Yeah.
You know, and it's interesting because my 5 years is up. I got to go back in and get scoped out. You understand, don't you? I'm sitting in front of the doctor today at 2:30, and my exact words were to him, "My son, how do I get him in to see him? Because he's got yada, yada, yada." So that's amazing to me, yeah. Thank you.
Right. So, I mean, this is a message we wanted to deliver to you, but I think it's a message that you already feel, this community feels.
Mm-hmm.
The last part that I wanted to highlight is, just to take you into what residency training looks like a little bit, it's not like what's on Grey's Anatomy. It's not like what's on House. It's not even what you might imagine. In the past, it might have been to some degree. Residents were definitely overworked, and they still work very long hours. But one of the things that the program at Bay Health has focused on is resident wellness. It's weird, right? It's not. Shouldn't we have been? Every program have been focusing on resident wellness up till now. Well, to a degree they were, but to a degree they weren't. This physician shortage exists in other parts of the country, and residents were depended on to really serve people. You can only serve people when you yourself are well, right? So all three of our programs are going to be focusing on the wellness of our residents and engaging them in the community. We want them to feel like part of this community from day one. We want them to fall in love with it. That's what's going to keep them here. Part of that is our wellness mission, exposing the community, showing them why this is a great place to live, grow, have a family, settle down, etc. So that's something that we'll be doing very actively throughout this training. That's the end of my presentation. I'm going to turn things over to Dr. Mitchell, who's going to be starting our general surgery program.
Thank you.
Thank you.
Thanks for that. That's coming up.
Seriously, just keep going.
Thank you, Joe, and thank you to the commissioners for allowing us to come and present. I wish I could tell you that I was as smart as Joe and Brenta. The reality is that there really was one, now two, very important reasons that I came to Dover. And those are my granddaughters who live in Greenwood, Delaware. Nice. And as I came here, I wasn't necessarily looking for the job as program director. But when they talked to me about it, I paused to think about it, and I heard about the shortage and the need in this community. And I thought again about my granddaughters and my daughter and my son-in-law, and I realized they need to have access to excellent care. And so that's what I'm really committed to bringing to the surgical side of this. And was hesitant at first, but when I met Dr. Deutsch and Dr. Vaskar and the others involved in GME and Terry Murphy, and realized that the board and everybody at the hospital are really committed to improving resident education and training excellent doctors, I realized that this is a place that I wanted to participate. My career started at Jefferson Medical School. I grew up in Newark, Delaware, and went to Jefferson Medical School. Did my training in Syracuse, New York, and unlike those people who were supposed to stay where they trained, I didn't. I went to Yale for a fellowship in endocrine surgery. I went to Ohio, to West Virginia, to Michigan, and have been in and out of private practice and university practice. But what I found is that patients' gallbladders and thyroid and adrenal glands are the same in all of those states. And the patients all need the same care. And I've seen patients who traveled 4, 5, 6 hours to get care. And I want to be able to make sure that we have excellent care here in the state of Delaware for my family and for yours. So our program will have only 3 residents, but they'll be here for 5 years. So when our program is full, we'll have actually 15 surgical residents working here. And we have just started the process of selecting for those 3 spots. We have just shy of 600 applications of people who would like to come and train in our program. So we're going through the process of sorting that out now. Our residents will work at both the Kent and Sussex campus. In addition, we will need to send our residents up to AI DuPont or Nemours Pediatric Hospital for their pediatric surgical training. They'll also go up to the Crozier-Chester Burn Center, which is nationally renowned for its burn wound care and their critical care training, and then to Jefferson for their transplant training as well. And this is what all of the programs will look like. And you see that emergency medicine will be starting again a year after us. Actually, the program director for emergency medicine, I think, is starting November 1st. And there's a lot of work that we have to do. There's a lot of work that's gone on to getting us to this point. Dr. Vaskar and Dr. Deutsch have been working very hard for several years getting things prepared. There's a lot of preparation. It's a very big cultural change. And I would just echo what Dr. Deutsch said in response to one of the questions, that it's not just about the residents that we're going to train and improve things for them, but it's about the people that are going to want to come
to train the residents. So we're going to be able to attract, and we're going to need to attract surgeons who have expertise, who can train our residents in areas of subspecialty. And they'll be much more inclined to come and stay and commit when they have residents to train and residents to work with. So we're really looking to optimize and maximize the training. Dr. Deutsch talked a little bit about the maybe the silly side of things that we see on TV, but I realize that patients are concerned. I'm not sure I want to have a resident taking care of me. Maybe not such a big deal if you're seeing somebody in the clinic, but when they're about to go into the operating room with me, all of a sudden, I'd really like the guy with the gray hair, and I'm not talking about Dr. Deutsch. I had a mentor who was just the best, and Dr. Patricia Newman was one of the first women presidents of the American College of Surgeons and one of the first women on the American Board of Surgery, and she had patients that came to her and said, well, I want you to do it. I don't want to have any residents involved. And she explained to every one of the patients the exact same thing, and they all finally saw the light. She said, over the years, I've developed a particular way of doing this operation with residents, and now you want me to change the way I do it and expect the same outcome? And the reality is, I think I do a pretty good job of operating on the thyroid. I never would have had that opportunity if she didn't insist that the patients let her do the operation the way she needed and was used to doing it. And that allows me to do the same thing with the residents that we're going to train. We are under very strict guidance about making sure that they have appropriate supervision, and so I think it's really important for everybody here and in the public to understand that our residents aren't running around like on the TV shows. They do have very strict supervision and graded responsibility, but we need to have them increase their responsibility throughout their training so that when we finish their training, they are ready to go out to Smyrna, to Milford, to Greenwood, and take care of patients. So that's our goal. One of the other things that we're doing in terms of safety for the patients is simulation. When I started in training, simulation was a cardboard box, and we put a little camera on the inside, and we put our instruments through, and that was laparoscopic surgery. Today, we're going to be working on a $1 million renovation towards creating a space, and probably north of $500,000 in mannequins that will allow our residents to practice numerous procedures, endoscopies, that scope thing. And they'll be able to practice without just doing it, just taking it out partway on a patient, but they'll be able to do it numerous times before they actually are involved in the care of patients. So robotics, endoscopy, trauma, chest tubes, all of these procedures, our residents will have training in the simulation lab, which again will be state-of-the-art so that they'll be able to do things most safely for patients. So I hope that we've painted a broad picture for you about the benefits of graduate medical education, the importance to the community, and our commitment. And I think the hospital, the administration, the board, and all the members on the medical staff that I've communicated with are very committed to training residents and doing an excellent job.
Mr. Buxton?
Just want to compliment leadership. This was a good presentation. You did good this time. But I want to say this, and it's different scale. Does it mirror Temple?
Does it mirror Temple in terms of
I understand in Temple. Well, I had a week stay there. It was a great experience. Is that a teaching residency hospital? Because that's what I experienced there. I thought.
Yeah, Temple University Hospital is a teaching hospital. Yeah.
So that's what you're explaining here too,
right? Right.
That's what I meant by mirroring.
Right. In terms of greater responsibility, obviously they have a little bit longer duration of experience and a little more reputation, but long-term our goal will be to have that kind of same experience, excellence in care.
Yeah, because my experience is if I have to go back, I'd like to go back. That was a great experience. I liked the interaction amongst the doctor, the residents. It was almost like you just double check, and I got the impression. I kind of liked it.
Yeah, and my primary colleagues usually talk about this, but the residents really do spend a lot more time. A lot of times you'll see the attending physician will kind of breeze in and breeze out and off to see another patient. But the residents, during their learning phase, have to spend more time with the patients to pick up the subtle, nuanced things. We can pick up on those things more quickly. But it does give more time with the patients. It gives them time to learn, but it gives the patients time to express things that they might forget to mention.
Yeah.
The doctor comes in and they forget what they were going to tell them, and we're out the door before you get a chance to tell us. So it's a benefit to us to have them there, picking up things that patients might not tell us. It's a benefit to them. It's a benefit to the patient.
Yep. Any other questions? I got one real quick. Dr. Dean Winslow, Jefferson Hospital. Did you work alongside him?
I don't think so.
Okay. He was a doctor that graduated from Dover High School and went there, and I know he was there at one time. Then he got called back into service, then came back again. But just wanted to know if you may have met him or came across him, because I believe he had a lot to do with the age research back in the late 80s to what we have today that preserves lives. So just wanted to see if you knew him.
Thank you.
Thank you, Doctor.
Good evening. I'm Lindsay Robenwell, president of the Bay Health Foundation. I just want to make a couple concluding remarks. And first, to reiterate our appreciation from Bay Health that you folks entertained this presentation and were so obviously attentive and interested in the information we are presenting tonight. I want to highlight just a couple quick things, a couple quick numbers. 50,000 additional patient visits. 50,000 is a huge number when these two programs we've begun with are fully staffed after just 3 years. That's huge for this area because, again, such a huge doctor shortage. Physicians going concierge every single day in this county and Sussex County, doctors retiring, doctors leaving the area, the population growing both in Kent and Sussex County, adding 50,000 visits on top of those physicians that following residency stay with us. This is a $20 million commitment from Bay Health. You heard Dr. Mitchell mention that the simulation lab alone is likely to be $1.5 million to construct the facility, fit out the facility, get the mannequins, which aren't cardboard boxes that you stick your hand through a hole in, but are really lifelike mannequins, can be $100,000, $150,000, $200,000 sometimes for some of those mannequins. But a $20 million commitment by Bay Health because this was the right thing to do. This was the right thing even before COVID. We started planning for a GME program long before COVID was on anyone's radar, right? And I know that some of the monies that you'll be responsible to spend from the federal government will be specifically COVID related. And although the nexus of the GME program in Bay Health started long before COVID, COVID has changed everything. COVID has exacerbated our need for physicians and has put a bright spotlight on the real lack of incoming physicians that we're experiencing in Kent and Sussex counties here in Delaware. COVID has permanently impacted Bay Health. I wrote down some notes so I wouldn't forget. We've had more than 3,600 patients sick enough with COVID to be hospitalized at one of our two hospitals over the course of the last 19 or 20 months. 3,600 Delawareans. We've lost over 300 people that perished under our watch from COVID when they're in one of our hospitals. This was not about COVID to start with, but damn it if everything isn't kind of about COVID in some way now. And so when you are making your decisions about how you might utilize and best utilize the funds that the federal government ultimately will send the way of Kent County, we hope you'll remember Bay Health and this program in particular. It is impacting in a dramatic way healthcare delivery in this county, and it will continue to do so for all of our foreseeable futures. This thing will build on itself. More and more doctors will come to Delaware, not because there's a medical school here, because there's not, but because they will have had residency programs here that taught them about COVID and how to treat COVID patients, how to treat cancer patients, and all kinds of patients across the spectrum. And so this is a critical, Bay Health's doing a lot of things, right? Whole lots of things that we didn't even bother to mention tonight. But the GME program is a gem for us, is a centerpiece for us, and we hope that over time you folks will find a way to support us. So any other questions we can answer for you while we're here tonight?
Questions for Dr. Lindsay? No?
Thank you very much.
Thank you. Very, very informative.
Thank you.
Thank you for your time.
Is that it? All right.
William, well spoken tonight, buddy.
Good job. Good job.
I was with physicians, the CEO of the hospital. Best thing I could do is be
Thank you, Bill.
Thank you, Bill. Okay.
Well, sure.
Sure. Go ahead.
I'm Judy with the Central Delaware Chamber of Commerce, and we've had the opportunity to work with Dr. Deutsch and Dr. Vaskar. I haven't had the opportunity yet to work with Dr. Mitchell, but we've been able to meet with the residents and kind of help them get acclimated a little bit to Kent County, in hopes that we can win them over and they will stay here. And I will tell you that if you get the opportunity to meet the individuals that they have brought into this residency program, they are nothing short of phenomenal. They are just absolutely intelligent people who want to be engaged, who want to do good work, who want to be good at what they do. They want to be good doctors. And if we're fortunate enough to be able to keep them, that will just be a wonderful thing. So anything that we can do as a community to support the program is just going to be phenomenal for the residents, and especially for all of those young residents who right now are looking for primary care physicians. They really do. They have the best of the best here, and we are so fortunate to have this program. I just wanted to say thank you, and thank you for letting the Chamber be a part of it. We've really enjoyed it.
Thank you, Judy. Okay. Central Delaware Chamber of Commerce, Kent County Tourism Proposal.
Skip one.
Sorry, I did. Report from United Way, Delaware, and Delaware Racial Justice Collaboration, Solutions to Support Our Vulnerable Populations.
Hi there.
Hello there. Welcome.
Hello.
Hello. I'm Shelley Checkett, the Executive Director of the Greater Kent Committee.
And I'm Michelle Taylor, President and CEO for United Way of Delaware.
And so thank you for letting us have this opportunity to come and talk to you tonight. First of all, I did think that Grey's Anatomy was like how it was in there, so I don't know whether I'm disappointed or relieved that that's not the case, but that was an incredible presentation. So you have seen me come year after year and come and talk about economic development and the DE turf. And tonight I want to come and talk to you about the incredible work that I've seen take place at the United Way. So about a year ago, I was asked to be chair of the Wealth Creation Committee for the ERJC. And during that time, I'll talk about that more during the presentation, but during that time, I was able to see firsthand all that the United Way is currently doing for our community. I will tell you that I am embarrassed to say that I had no idea all of the programs that they are currently utilizing to reach such a vulnerable population in our community. And again, whether it's financial literacy and helping people to get their first car or their first house, or it's dealing with learning pods, or it's dealing with healthcare. The work that Michelle and her team is currently doing is incredible, and I knew that you would want to hear what's happening. So with that, I want to turn it over to Michelle, who I will tell you is one of the hardest working people I've ever seen. She's that person who responds at early crack of dawn in the morning and late at night. So I know that if you don't already know her, you will love her as much as I have loved getting to know her as well. So with that, I'll turn it to Michelle.
Thank you, Shelley. So I wanted to talk to you today about what we've been doing to fight for our most vulnerable populations, and not so much, I think, what we've been doing like over the years, because we've been doing a lot, but what we've been doing during COVID and what we see post-COVID looks like for our communities. Sorry, did I just get to click this? Yeah. Thanks. So there's a really big focus on where our kids are. So I would say at the crux of what we're trying to do is help to build a more diverse, qualified workforce for Kent County. I'm going to talk specifically about Kent County. And we know that what we do downstream matters, right? And so we have been working to try to make sure our kids can read by the time they, get kids ready for kindergarten, but really making sure they can read by the end of third grade, because the research says where kids are at third grade is a strong indication of where they'll end up in their future. We also then, during COVID, the superintendents asked us specifically to add math, because you're going to see how the grades have slipped significantly during the COVID, due to COVID and our kids going to digital, right, and not having all the supports they needed. We also are trying to make sure that by the time they get to high school, that they have pathways that lead to a career that ultimately, hopefully, we can change their trajectory, where it leads to a livable wage job, where the livable wage is the floor, not the ceiling, that they have opportunities to be able to realize their full potential, with a big focus on that zip code does not matter, right, from where they are. So for us, COVID exacerbated just so much for our students, which you'll see in a minute. And so it really does require like a 2-generational strategy. Shelley's going to talk about the wealth creation part in a second, but I'm just going to focus on the education part for a moment. Maybe I'm going to focus on. So we at United Way of Delaware, I don't know if you know, we serve the entire state of Delaware, and we also now serve Salem County. We've been over in Salem County for over the last 3 years. But we like to say that there's promise communities. So these promise communities in Delaware, there's 8 of them. They have the greatest needs. So these, we don't like to call kids at risk. I even hate to call communities at risk. We like to look at it from an asset perspective. So in Dover, as you can see, it's the blue population, which is a big part. The blue and green, right? So what we're calling the North Dover Ring and the South Dover Ring of where the greatest needs generally exist. And for that, it's not that we don't serve other areas in the state. I want to say that too. It's primarily where we're putting our resources. We realize that if we're going to try to have impact, we were going to have to be more laser focused around where we invested our dollars and our time and our voice. And so across the state, one of the things that you'll know is that the crisis around, it started out being unfinished learning last year, and now they're talking about it in the terms you probably heard, accelerated learning. What are we going to do to really to be able to catch kids up? So last year when we were thrown into the crisis overall, we actually said our fight is that our kids are going down this slippery slope, right? The achievement gap is getting wider fast, right? That 81% of the kids cannot read on grade level overall, and that 86% of them can't perform at math. And if we don't catch this up, we're going to lose a generation of kids that we're trying to do this. We also know that the kids that don't read are 4 times more likely to end up in prison, and that 2/3 of them, 2/3, I'm sorry, were likely to drop out. 2/3 could end up in prison or on public, I hate to use the word welfare, but public supports and services, right, in our state. And ultimately that suffers and drains our economy overall, right? We're trying to get people to get beyond that. And so if I kind of just illuminate the problem, this is right here in Kent County, that before COVID, only 45% of kids were reading on grade level, and that after COVID, it's only 25%. Now, if you paid attention to your school districts, a lot of them have put disclaimers that when last year they were required to test federally, right? I know there was a lot of debates with superintendents, did they want to actually test kids? Because kids have been in these digital and virtual environments for so long. So they didn't necessarily test the same number of kids that they had before, but these are the numbers that are actually posted on the DOE website for Kent County. So where we already had 45% was and the state average before then was like 53%. So Kent was a little below the state average. At this point, the state average has dropped, as well as the average specifically for kids right here in Kent County. And the question is, like, what are we going to do to quickly try to catch them up? For math, we were asked to add math scores. 46% of kids were on math, and look how dramatically math dropped during COVID from your testing from last year. And so what we're really trying to do is to say, how can we really be more laser focused on catching kids up by partnering with the school districts and the CBOs? If you fast forward, because it all ties in, because we're going to talk about our solution in a second, the same thing spills over to math, right? I mean, to high school. High school kids, we have less time to catch them up. You know, kids that were seniors last year or seniors this year, there's like this, like right now, we're really trying to be laser focused about what are we doing right now when there are a high percentage of kids that graduate. Del Tech talks about this already. We're taking remedial courses. So what can we do to try to give more tutors, wraparound supports, maybe some helping them to tap into recovery classes to try to prepare them for a career and or into the college. One of the solutions we did last year is we partnered with the Delaware Racial Justice Collaborative, and we started something called Learning Pods. And the Learning Pods were partnerships with the school districts. So if you can envision this, and parents still had to work, but their kids needed a place still to make sure, somebody had to make sure they were actually on the Zoom. Someone had to make sure, right, that they were doing their class. So we partnered with the First State Community Action, who's still here, with Green Beret and the Boys and Girls Club. And what they did is they provided on-site structured supports for a number of kids. And so when kids came there, they got breakfast in the morning. Someone made sure that they were on Schoology, that they were on their Zoom with their teachers, that their classworks were being done. We provided virtual tutors. We provided actual tutors from Back to Basics to actually to be there to be able to support them. We did things such as if they needed eyeglasses, right? We made sure they had free screening so that kids had eyeglasses. We worked with parents if they needed food. You know, we fed them during the day, but we also took care of family supports. And this was extremely important because the best part of it is we were working with the school districts. The school districts knew where their kids were. And so they helped us to make sure that we tapped into Schoology. They helped us to make sure if kids had needed additional supports. It really was the most amazing partnership between community-based organizations and the districts as a whole that I've never seen. And we're hoping to be able to carry that now into post-COVID. And the other thing I wanted to tell you about that is they met every single week. So the community-based organizations met with the school districts, they met with the Department of Education, they met with Verizon. We paid for, if they didn't have Chromebooks, we bought them Chromebooks. If their families didn't have internet, we paid for internet for their homes for 9 months because they needed to have it for the whole school year. So we kept trying to remove every barrier that they had. And here were our results last year. There was a 91% attendance rate. So in the pods, kids showed up 91% of the time for the entire school year and during the summer. 79%, little below our target was 80%. 79% of kids for Kent County actually completed all of their assignments. And 97% of them actually participated in social emotional learnings that took place, right? And we had it at 3 sites, and we had it for 65 students here in Kent County. This year, we're hoping to continue the Learning Pods. Last time, the gap for Learning Pods was not about catching kids up. It was making sure the gap didn't get any wider. It literally was about making sure kids had a structured place to learn, that they were on their Zooms and they had the supports. This year and the following year, we want to have a 2-year strategy. We are really focused on, put this down, thank you, is really about catching kids up. Now it's all about accelerated learning. So in partnership with the schools, we really want to make sure that they are getting an additional in the afternoons, 45 minutes of literacy and 45 minutes of math throughout the through the time during the day. They'll get additional tutors and supports that they may need to be able to catch up, but envision that it's not your normal out of school time, come in the afternoon. This is really about understanding that their classwork still needs to be done, but really trying to focus on closing the gap of where they are. Our goal is pretty aggressive for kids this year. We want them to have a 90% attendance at least in the school, right? Because if kids don't show up, right, they are not likely to learn. We want an 85% attendance in the pods during the school year. We want a completion of all their assignments at 85%. We want 50% of the kids to show that they had some level of improvements over from beginning year. And we would like about 10% of kids to show that they're on honor roll. Right, they're working. Year 2, it's a little step up. It's like 60% of kids show improvement, 15% of kids go to honor roll. I should tell you that last year in the pods overall, it was 65 here in Dover. We had over 700 statewide. We had about 10% of the kids made honor roll. last year. Mind you, weren't trying to seek it. And we had about a little less than 20% of them actually showed improvements, right? We had a couple of kids that were failing completely before they went to the pods, that by the time the pods, they were all passing. Didn't say they were doing extremely well, want to be honest, but they were passing. They passed, and we had at least 2 seniors who would not have graduated last year. The pods are K through 12, right? So 70% of the kids have been from the K through 5, and about 30% have been 6 to 12. And that 6 to 12 is really important because those are our kids. If you know, my kids are now much older, but when you had kids that are teenagers, it's more time to get into risky behaviors. Parents are working, no one's not home. There are certain places like the Boys and Girls Club that intentionally wanted to focus on First State Community Action, even Green Beret too, I think. Like they wanted some more of the older kids, right? They wanted to target the kids that were in that middle school to high school to make sure, right, that they had a more structured setting to succeed. And here's just some of the supports that we provided. The virtual tutoring, there was some in STEM literacy. We did trauma-informed for all of our students. Last year, there was a lot of concern about because kids weren't in school that we weren't identifying a lot of the of domestic violence and the abuse that's taken place. So we worked with the Jewish Family Services, and they came in and trained all of the pod staff on how to identify if abuse maybe was taking place, right? They really felt like the numbers went significantly down last year, and they don't think that it went down because people weren't being abused. They believe it went down because kids weren't in the classrooms and it wasn't being detected. And then we really tried to incorporate, which we're going to talk about in a second, some Stand By Me financial coaching to the parents to help them to be able to transition. So the work that we're doing over the next couple years, while it's not tons of students, the students that we are serving from a capacity perspective, we believe can be a game changer to help these kids go from such a significant deficit to getting them back on track within a short time period.
So again, about a year ago, I had the opportunity, Michelle asked me, and actually Bernice, who's here also, to be chairs of the Wealth Creation Committee. And as Michelle was talking about, the whole goal of this is how can we end up creating young people that we can then transition into into our workforce. And so the focus of the Wealth Creation Committee, we've divided it into 3 goals initially. The first is on financial literacy and home ownership. What can we do to make sure that more people are owning homes, and how can we make sure that they understand the financial literacy behind it? We are talking about entrepreneurship, and then we're talking about workforce development. Do you keep going?
Yeah. Commissioner Howell has a question.
Well, actually, I was going to make a comment when you finished.
Oh, okay.
Oh, okay. So, and then the other leg of that is workforce development. Within workforce development, what we've done is we've taken a 2-prong approach. We've talked about what is our business's responsibility, and what is our workforce's responsibility. And what I love about the conversations that we're having around workforce development is that it's not just about how can we get every kid into college. We're having conversations about certification programs and about the fact that we don't want kids who are talking about being in or taking the track of certification to think that that is less than going to college. The studies show that you can make more money throughout your life if you take that track versus the other. So ultimately, what we're doing is, and what I love about this committee is that while this is a statewide committee working on workforce development, the partnerships and collaborations that are taking place, I think, are truly going to make an impact and difference with our workforce, and addressing the needs of what our business community needs. Because the people in the room it's the business community, it's the people that are providing services, and then it's community as well. So I'm appreciating the multi-prong approach. And I'll turn it back to Michelle to talk about additional, unless you have questions first.
Well, I just want to make a comment for what it's worth. I'm sitting here looking at all the statistics and hearing what you had to say. I taught at the Delaware Correctional Center for almost 30 years. and you're bringing back all these memories, you know. And believe it or not, most of them are pleasant, very interesting to me. But I did the testing for the entire prison for years. And when we use the TABE test, are you familiar with that at all?
I'm not.
It's for adults, so it wouldn't really pertain to you. But it converted the scores into a grade level equivalency. So I might have a 7th grade, 6-month reading level, and a 5th grade, 4th month math level. And typically, the reading scores were about 2 years up. So if he had a 7th grade reading, he probably had a 5th grade math. Now, it didn't always work that way. I say, I did a project when I was working on my master's, and this teacher was very interested in what I was doing. So he's giving me these tests to give him and stuff like that. And it was very interesting, but my major was history education. But when I got to the prison, the biggest need was arithmetic, not really math, not algebra, not that anywhere near that high. But I mean, these guys didn't know their multiplication tables. I found out, you know, like for instance, they'd have difficulty with division. And I found out it's because they didn't know their multiplication tables. And so that was the first project we had to hurl through. Now, I invented a method of division, whole number division. I can show it to you sometime if you want. It's really quite simple, but it's very effective. My youngest daughter is 24, and she still does it the same way. But it was a very, very interesting environment to be in. Once you get to the classroom, you got to get there first. And we had to walk a long ways. And they reserved me and one other teacher for the super high security. So we had to go over to the segregated housing, you know, guys that were in there for discipline problems and stuff like that. And you ought to try explaining fractions, like he's in the cell, you're showing him on a piece of paper over your shoulder. I mean, it's a weird environment, but it's very unique, and that's why I liked it. But anyway, I just thought I'd throw that out there because, generally speaking, anything with education is of interest to me. And anything that can be done in the early ages to lay down the foundation is, I mean, it's just about the most important thing you can do is help a person to learn how to read and do the basics. I figure as far as math goes, if they can do whole numbers, fractions, decimals, percents, and integers, they can handle most anything that comes their way. It's only if you get into like computers and stuff like that, you know, where you have to know the higher level stuff. Most people don't. So I just thought I'd share that with you because it was interesting to me because so many of the people, so many of my students fit the description that you depicted.
Well, and I think your point of teach Amanda Fish, I think that's similar to what the approach is, you know, let's teach these young people the skills that they need so that they, in the end, they can go out and get the jobs and they don't end up with you teaching to them behind a...
Yeah, well, that's the goal, but I should mention that my last day at the prison was the day before the riot.
Oh, my goodness.
And this other,
Same building?
Same building, yeah. I taught in C building. And it was the weirdest thing. I could talk about this all night, but I won't, you know. But I'm watching TV. This is my first day of retirement. And I'm watching the news, and all of a sudden here's C building from a helicopter view. I said, what in the heck is going on? Because I was just there less than 24 hours before. And so my now best friend was a co-teacher with me, and we were talking about who we figured was involved in the brutal scenario. And it turns out we were right. We were quite accurate. Of course, they couldn't prove anybody was guilty, but they knew who was. And but some of them were diligent students, and that's the irony of the whole thing, you know?
Right, right.
It doesn't really make sense. I mean, human behavior is just very puzzling.
Yeah.
You know? But anyway, keep doing what you're doing. It's good.
Thanks.
Anything you can prevent and help, I'm all for it.
I'll just say this real quickly. I think as it relates to this, so my granddaughter was in 3rd grade last year, and you know, to your point, you know, we learned basic math, right? How to add, subtract, then multiply and divide, right? Even my kids, I told them they had to do all the multiplication, right? They timed it, you know, 0 times 0 and 1 time, 1 all the way to 12 all the way down. That's not how they teach kids now. I'm literally on the internet trying to figure out how to do her Common Core 3rd grade math. It was extremely difficult, and it was an interesting experience for me, because if I can't teach a 3rd grader how to do math the way they have, can you imagine how most parents this last year probably struggled significantly? I could get to the answer. I could show her my way how to get to it real quickly, but that's not what they wanted, right? They wanted her to do it their way and to be able to show it. So that's another whole debate and discussion, right, for how our kids learn.
It's not a debate. And if you gloss over that, you can do whatever you want.
Right.
You're going to fail.
Right.
I can tell you, and you've heard this 1,000 times, in 2012, in 2014, 2018, where I wrote position papers against this global push, where I explained the value of skills trades. In 2021, just the other day, there was a big fancy ceremony where they signed the documents,
Yeah,
I guess,
the
to
bill,
do something.
yeah.
That's great, and I'm glad. It took a while. I wasn't wrong then, they're not wrong now, and I'm not wrong about this.
About Common Core.
I am telling you, and it has nothing to do with the political ideology. If you want kids to be good at skills, then let them be good at skills. Quit trying to teach them to be creative about fixing a transmission. That's what we're doing wrong at 3rd grade. And you know what else we're doing wrong? And if you don't take this message to the folks that can change it, and I'll get to what you need to do in a second, if you don't take the message that they need to learn the basics and quit pushing them through the hole so that you get to the common end.
Yeah.
Which produces what you produced. They made it. They checked the boxes. They don't know what they're doing.
Right.
They don't have usable knowledge.
Right.
But they got there.
Right.
So if you want to fix the learning gap, you know what you need to do? There needs to be an executive order that states for the school year 21, 22, 22, 23, we're going to downsize the required amount of credits and the required courses to advance from 3rd, 4th, so that we create space in the curriculum to give 2 hours of math to that child that's behind, so that they don't rush over to home ec, or they don't rush over to their 2nd language when they can't speak their primary language. All right, I'm off the soapbox, but I've seen so many of these.
Oh, man.
And if you don't get to the right people, we're going to lose.
I hear you.
I totally agree.
I hear you.
You get an argument.
And again, it's what the passion that I hear around this table is the reason why, as soon as I started hearing about the programs and the things that Michelle and her team are working on, it has to be a priority of our business community that we look at new ways to tackle this. Because the way we are continuing to do it, we're losing. We're losing. And so we need to figure out new ways to do it.
Bring me the math teacher in high school that is demanding that 4th year of math is relevant to anybody.
Right.
That's right.
To anybody. That Algebra 2 is a requirement to be a functioning adult in this
day and age.
Universe.
Right.
But that's what we're doing.
Right.
We're taking my 220 wrestler who barely made it through school. Why? He's making more money than I ever made.
Right.
But he failed to get that 2nd year of language.
Right. Right.
What are we doing?
Right.
All right, sorry.
No.
Okay, I'm going to keep us moving. I'm sorry. I totally agree. So this is on the adults now. We're going to transition to adults. So we know 42% of our families in Kent County cannot meet their basic needs. We're going to be coming out with a report in about a month, and it's going to be called ALICE. And really what ALICE is focused on is asset limited, income constraint, employed. So really it's the individual that's working every day but makes too much money to qualify for any benefits, but is just living on the edge, right? So they still barely have money to be able to pay in maybe more than 30% of their household income still in rent. They still barely have any money if their car breaks down. They're just one paycheck away, right, from just falling off of the edge, right, and needing supports and services that they don't qualify for, where it's the community-based organizations in. But that represents about 42% of the families that we have here in Kent County. The one thing we know is that there is a big gap still in the wage, which is what we're working with Shelley on, right? That says we have to change the trajectory to get more individuals to get at least to a livable wage job, so that we are giving them a fish, teaching them to fish. We always like to say there's way too many families, right, that are in crisis and too many kids in poverty. It's what drives us and what's fighting us. We also know that there's a lot of families that's on the verge of being evicted and, that are living hand to mouth, and, children still go hungry, and that these are things we have to fight for. And our solution here is we've been doing something, I don't know if any in the room heard of Stand By Me. It's in partnership with the state, and it has been expanded. It's 10 years, celebrated our anniversary this year. But right now, Stand By Me has helped 2,000 clients in Kent County since the pandemic right now. And those are clients that we were already generally working with. So I like to say two things. Clients we generally help were already stable, and they've been working on budgets, right? So they're trying to say, I need to clean up my credit. I want to buy a car. I want to buy a house. I need to pay off my debt. I need to pay off my student loan debt. It could be whatever they're shooting for. And we've helped them to reduce their debt by $2.3 million since the pandemic for the 2,000 individuals that we're helping. For home ownership, there are 100 individuals right now in Kent County that say they're in the process of trying to purchase a home, right? So we're working with them still on their budget, still making sure they have the credit that they need, still making sure they have the down payment. But we also work with them to make sure they have the household budget to stay in the house when they get it, right? And so we're teaching them all of those things. That the Stand By Me, we started a minority business program because minority businesses failed 4 times faster than any other business before COVID and during COVID. And so we are now, there's not many businesses from Kent County. I think that there's maybe about 10 that are in our program that we're working with them. And small businesses, a lot of times their personal credit is tied into their business credit, right? And so we're working with them to be able to clean up their personal credit. We're working with them to put a budget in place for them individually and with their businesses so that they can thrive. And ultimately with Stand By Me, we're also in the high schools. We're working with the 9th through 12th graders, and we start from 9th grade getting them to think about a budget. We get them to think about, well, what career do you want? Then they have to research it. Then they have to say, how much do they make? Then we teach them to make a budget off of that. Then they try to look at what quality of life would they have. When they get to 10th grade, we kind of repeat it, except now we say, well, if this is what you want to be, what classes do you have to take? Right? What do you need in order to be this? What do you need in order when you graduate to be able to do it? By they go on to their following year, we kind of enhance it. And then their senior year, we help them fill out FAFSA forms and apply for college education. And we're now really starting to add that career readiness piece in that says, so I don't want to go to college. I want to go to a trade. I want to go directly into the workforce. So we're trying to figure out how do we help to give them those soft skills that businesses are so much telling us that are needed, that are just missing. So how do we kind of give them a leg up on that? And then so Stand By Me has all these components. It's a piece that's working with our families that are already kind of, I would say, stable to empowerment, right? And then we're working with those that are trying to purchase a home. Then we're purchasing with small businesses, but we're also working with a group that's calling 211. So that means you call and you're in crisis. I give you an example. We're working with a family. They are not from Kent County, but I actually start working with them. They're in a homeless shelter, a mother of 6. Has housing, right? And I'm not sure if you know this. I didn't figure this out until during COVID. In order to get Section 8 housing, you also have to have utilities. So another policy that we have, and I'm not saying everybody needs utilities, but if you're in your house and your utilities get cut off, it's not grounds for eviction, right? You get to stay in there until you figure it out or figure out something else. Here you lose that benefit of housing if you don't have, which is why we said so many people are on the cusp. There are more families that are homeless right now just because they have outstanding electric bills, right, that they cannot pay. And so we're trying to work with Delmarva to see what we can do to put a dent in that and to figure out how do we prevent it. There's a difference from dealing with the symptoms than trying to deal with the root causes. And so like your policy changes, right, and we should be advocating for school years. That's kind of getting to the root of what needs to be changed. while a lot of the times, right, we quickly just try to deal with the systemic. So we're giving people coaches. So like this mother that's in the shelter, we helped to pay her electric bill. We worked with Delmarva to make sure that it's paid. We helped to put, she has a house now to go in, but we also made sure they're going to give her credit to cut the new electric on, because we wouldn't pay the old if we didn't know that that was going to happen. And now we're about to adopt this family, right? Because they move in out of homelessness. They don't have anything basically to start over. Those are families we're helping for 211. We got around 11,000 calls from residents of Kent County from 211. And those were individuals that were calling us that said, my lights are about to be cut off, my electric is about to be cut off. It could be they needed immediate health care services. And not all of them, I can tell you, have happy endings. We don't always have the resources for stuff that they need, but we do our best.
Ms. Buckland.
So maybe not the place, although you're here, and how you ask the question is really difficult. How do you keep up with a single mother of 6? How do you keep up with benefits that adjust for that scenario, because that scenario is now expanding? Is that a fair statement to make, or even to ask?
No, that's a fair statement. So, like, you know, one of the things that we do is we can help get her out of homelessness, right? We can get her stable. We connected her to her coach. So now she has a financial coach that's working with her on a budget to try to figure out what her path is. But where that ends up long term, we can get someone to adopt her. But adopt the family, but some of those questions are still unknown.
What I was asking is,
okay,
we can address that specific situation, but we can't address the expanding situation, if I'm calling it correctly, I have to articulate my words right, which creates, there's more and more like her in that situation.
You're absolutely right.
And the more we feed that,
that's right,
the more we produce that positive outcome that we want to have,
right,
more likely others are going to access that problem. I see it in the school districts with special education programs, 504, and the IEP program. That's a bigger question to ask.
Right.
But I think at a table, when decisions are made, that's one that has to be looked at. What do we do there?
Yeah, I think it's this balance, right? So between, really, we're trying to deal with stuff at the root causes, and we're trying to deal with stuff at the grassroots.
Mm-hmm.
So in some cases like this, right, we can help family after family after family after family after, we can help hundreds of families, right? But at the same time, we got to be fighting for policy changes that ultimately change the trajectory for individuals like this, right? Because a lot of the families that we're also helping, they are working families. They're, I hate to use the term working poor. That's why I think we're going to try to come up with ALICE, and try to be able to give it more of an asset perspective. And the other piece of this, maybe you were getting to this, is that there's always the risk too that says, as we help this family, like there's a stream of other families behind it that's kind of looking for the same thing. And we try to avoid just giving people a handout without giving them a hand up. Right. So in this case, they had to agree to see a coach. Now, they could say they're going to see a coach now because I'm desperate, right? And so there's no guarantee that they're going to be still seeing that coach 6 months from now. But that's what we hope happens, because the coaches will stick with them for a year or 2 years or 3 years as they need it, right, in order to get on a more stable footing. That's our solution, is to give people a coach. I think I'm at the end of my thing. Yeah. So really it just says, like with statistics like this, right, we got to be bold, we got to move swift, we got to be more intentional. I use the definition of insanity all the time. We cannot keep trying to do the same things over and over and again and expecting, a different result.
Mm-hmm. And so thank you. Thank you for hearing the presentation tonight, for learning more about what's taking place. I think that, as this continues to grow, we would love the opportunity to talk to you more and think of the United Way and the work that they're doing as a resource and a partner in the community. Again, I'm impressed with the fact that it's not a Band-Aid, it's giving people tools and resources on how to change their lives. So thank you.
Any other questions?
No.
Thank you all.
Thank you.
Thank you.
Central Delaware Chamber of Commerce and Kent County Tourism proposed grant program.
Got a tough job. Ooh. Ooh, I can't imagine.
There's some terrible rumors going around about you.
Oh, don't worry, I'll be sticking around doing something. Well, thank you. Thank you all very much for having us here tonight, all the commissioners, and thank you, Mike. We had been asked as organizations, everyone is aware that Kent County Levy Court is getting ARPA funding, and we had been asked as organizations representing large populations of our business community to reach out and try to come up with some information for all of you to help you all make some decisions on where some of these funds could actually be utilized. So we both put together, Pete on behalf of Kent County Tourism and myself on behalf of the Central Delaware Chamber, we put together a task force. We brought people in from different industries and we talked with them about what is it that you really need right now. And our focus in both of these presentations, and I think you all have copies. Do you have copies? Because if not, I have copies. Mm-hmm. Okay. What we're really focusing on is trying to stand up the businesses that are employing the largest parts of our population here. Because in order for us to have a healthy community, we have to have healthy businesses, we have to have healthy residents, and in order to do that, they have to be able to get employment. So I'm going to let Pete go ahead and start off, and he's going to talk about the hospitality grant program.
We coordinated very closely so we didn't have overlap and duplication. And obviously, we all know the hospitality industry has been significantly impacted with COVID.
Excuse me, Pete, is that microphone on? Is it a little green button lit?
Yes.
Okay.
I'll get a little closer.
There you go.
Okay. Obviously, significantly impacted. And two quadrants, two areas. The hoteliers, significantly impacted. And we have banquet and meeting facilities, firehouses, performance venues, restaurants, senior centers. It's been devastated as well. And one of the metrics to show this devastation is there's the public accommodation tax. And the 12 months ending March 21, you compare that to the prior 12 months, it was down almost 42%. And you look at that metric, and that really covers the entire hospitality industry. The impact. For the hotelier, again, for us from a tourism perspective, folks not coming here, staying overnight, obviously has a huge impact. And we all know now with the recovery underway is that the hoteliers, the banquet meeting facilities have a heck of a time to get staffing. And we have hotels, major hotels in this county, where they have a significant number of rooms, but they cannot turn the rooms artificially low. Use Dover Down as an example. They have 500-room hotel, 150 during the week, 400 on weekends because they cannot turn the rooms. That impacts the entire county and staffing. So that's been an impact. So designing a program, again, we'll talk about the hotels first, is that we designed a program for the 12 months ending of March of 21. They compare that to the prior 12 months, and they have to submit a monthly PAT tax to the state. And so they submit this report. They could submit it to Kent County Tourism. Obviously, it's going to be a decrease. And so the concept with this program is that decrease could be a potential grant for that hotel. What we like about the program is it's documented, it's verifiable. We could verify with the State Finance Department that was, in fact, the PAT tax they submitted for the 2 years. So we know, that's a good number. Again, hotels could use that for staffing, improving staffing and compensation, everything else to get back up to run. Give you some metrics. For the 12 months ending March 21st, the PAT tax submitted to the state for the entire county was $2.1 million. The prior 12 months, it was $3.6 million. So $1.5 million lower, about 42%. That could be the potential grant. If Hotel A, had 50,000 PAT tax submitted for that year, and in the prior year was 100,000, potential grant 50,000. The other, aspect which has really been impacted is our banquet and meeting facilities, the firehouses, and the lifeblood of this county, the senior centers, the restaurants, performance venues have been dramatically impacted. So for that same time frame, and what we're looking at is they would submit a P&L for both years, profit and loss, comparing the 2 years. Obviously, it's going to be decreased, and that decrease would be in the form of a grant. Again, I think a lot of these operations have done other grants or whatnot, and they have accountants or whatnot. So to submit to us, we both use Forecast, and we're going to need the help. I mean, I literally have a staff of 3 to help with the administrative aspect. And our approach is anything we can do, our 2 organizations, to make it easier for Kent County, because you don't have a big administrative section, to make it easier to do this. We're happy to do this, whatever we can do. So I think we're asking for, I guess, $2 million in this proposed investment for these areas. Like I said, I think it's straightforward, it's tangible. I think one of our goals for both of us is to have programs that are comprehensive, documented, but not a 40-page application for that organization. And the same token for you guys is that it's verifiable, it's documented, it's auditable, because we have to report for the federal are these funds legitimate and valid for the purpose. So that was kind of our goals to do it. Happy to ask any question and answer any questions. That's the hospitality grant aspect of this.
How many hotelers and are we talking about? That's
We have, for Kent County right now, we have a little over, I think we have low 30s, about 31, 32 hotels in the county.
Any other questions?
Yeah. Are you asking the city of Dover, same thing? I mean, presenting this to them, or?
The first one we're presenting to is Kent County.
Because the city of Dover will be getting funds as well.
Yes. So
as well as Milford and Smyrna.
I guess on behalf of the hospitality industry and small business, we would go anywhere, yeah. Our organization, we've been impacted by the PAT tax, but I think our possibility, Kent County Tourism, we can get some state reimbursed from the EDA grant, working with Liz Keller from the State Tourism. And our first priority is for our partners. We don't want to duplicate our needs. I think our needs can be maybe from the state level. And obviously, we'd be more aggressive with advertising and other things like that to support the county.
Commissioner Buxton?
Thank you. I think you guys did a nice job. I like the tangible aspect. I like it simplistic. I like the fact that it clearly would suggest was intended for the purpose of the funds. So I like all of that. Hopefully we avoid any overlap. We don't want duplication of grants.
Correct.
We can make sure that doesn't happen. In fairness, I may take a different approach. The cities, we were given a pretty good sum, the county was. In the grand scheme of things, the $2 million, certainly doable. And if that takes some of the pressure off the cities, having to use some of their resources to fund this, if we can partner by taking that off of their plate, I think it's a good idea. So I'm not sure if I'd be as concerned, that's just me, be as concerned to getting Dover to jump in. But that's just my thoughts. Or Milford, or wherever.
Anybody else? Commissioner Hall?
Just to dovetail on that, I wouldn't want to hold up help to those industry groups waiting for the city of Dover to make a decision one way or the other. I mean, I think the need is real, it's documentable, it's tangible, and we've been holding this money now for a while. And although I saw the request for professional services just go out, I'm just going to suggest we move quicker rather than slower on this. to help them out.
Well, we know they're living on the edge, and we know a lot of them have closed businesses and stuff. Is there any, how do I put this? They're all in need. But are there any going to be leaving us before January if we don't do something sooner?
I'll defer to Judy. You know, the other major program we have is a small business grant, and that's kind of comprehensive and the whole approach is organizations that have 100 employees or less. And I think we all know the heartbeat of this county is these small independent operators. And so I think, and Judy could speak to that and has some hard stats.
Just
Judy, hold on a second. Commissioner Buxton?
It's important, perception's reality. Make sure that hotelier or hotels are put online or equal to the other industries, so that it doesn't perceive to be,
Right.
It's important across the board. That's all. So just encourage you to make sure that they're both broadcast at the same time.
And the devil's in the details where if a grant is given, you have the forms and everything else, the requirement that those funds have to be used specifically for recovery and for efforts to address their situations, and unused funds returned, whatnot, and certification that this information provided is accurate. All the stuff you guys know that we have to do to put some hooks and requirements in there for that organization.
Yeah, and basically, again, what we're doing is we're presenting two different grant programs. One is for the hoteliers. The next one that I'm going to speak about is for the small business. And we actually are using more of the national definition for small business. It's businesses that have 100 or less employees. At the Chamber, we've always based it more on, 50 or less, but for this purpose, we need to do 100 or less. And the reason why we're doing that is because it encompasses more of our county. Just at the Central Delaware Chamber alone, we have 804 members. 633 of them would be eligible for this grant. So think about that. Out of 804, 633 would be eligible by the standard of what we're going to define as a small business. During COVID, from April 2020 to July of 21, we lost 53 businesses here in Kent County. 53 businesses. And we have a lot of folks right now that are holding on by a thread. And I'm sure that some folks in your tax office can probably vouch for that. You have some folks now that can't even pay their tax bill. Businesses out there, they just can't do it. They don't have enough to make their ends meet right now. And the bad part is, we're kind of coming out of COVID, but they can't get their employees back. They don't have enough money. They've used all of the resources that they have. They can't pay their vendors. So we're seeing a lot of businesses that could be open full-time. Now we're only open on a part-time basis. If you look at some of the area retailers, for instance, they're now open on Thursday, Friday, and Saturday, where they used to be open Tuesday through Saturday. They just can't do it any longer. They don't have the staff, and they don't have the money to be able to pay for the electric or to be able to pay to have cleaning crews come in, because the less they're open, the less they have to pay cleaning companies to come in. Instead of paying them 4 times a week, they pay them twice a week. It's that basic. And again, as Pete said, we're modeling the programs the same, so it'll all be based on their profit and loss. They're going to have to show a 12-month profit and loss, and then their grant would be based on that. And it would be for the same period of time. It's during COVID. And all we're trying to do here is to get these small businesses back up on their feet. Give them the opportunity to recover from what COVID did to them. Because again, it was of no fault of their own that many of these businesses were closed. And they were closed for almost a year, some of them. And again, that was not their choice. It was mandated. So what we're trying to do is stand up a program that will actually give them the money they need to get them through and to help them really recover.
President?
Pepper?
And for this program, because again, we think it's going to cover a wider swath of business, if you will, in Kent County, we're looking at $3 million for this investment, and we are asking that this be rolled out as soon as possible, because we do know that we've got all of these businesses that are, as I said, they're hanging on by a thread. And all we want to do is be able to offer them a way out, you know, a way to hold themselves over and get themselves into that first quarter where hopefully things will really open. Their employees will start coming back. We're going to actually start seeing things really open again.
President?
By means of comparison, for purposes of comparison,
Mhm.
how many businesses went out of business in 18 and 19?
I'm sorry, but I don't have that number.
Of the 3 million you're asking for, of the 603, that would help all of them? The businesses that are eligible now?
Well, they would have to apply. Now, we do have a little bit of more stringent qualifications on this. It would have to be independent small businesses. We are not going to, we don't believe that the fund should be available for chain or public companies. It should be the small businesses here that are founded in Kent County. They have to go have their certifications. Grants have to be allocated, and it has to be used to enhance their operation. So there are some things that we think, you know, we have to put some parameters on this. But what I'm saying is they're all eligible because they have less than 100 employees. And some of them, I mean, we all know that there are some businesses that thrived through COVID. But for every business that thrived, we have 3 businesses that didn't.
Would this be also available to a non-member through the chamber? Because you're right now, I think you're talking about just membership.
Well, that's the only data that I have. Right. I think if we do this, I think we open it up to the entire county.
Exactly.
You have to.
Mm-hmm.
Yes.
So we would open it up to the entire county, but they would have to, again, we would funnel their information through the chamber, through Falcasson, because what we want to be able to do is give you all a spreadsheet of who applied, what their loss was, what the percentage is that they're asking for in a grant, what they were given, what the money was used for. We want just to give one spreadsheet to you guys that gives you everything that you need in a snapshot.
Agree. Commissioner Masson?
Not to repeat what Commissioner Hall said, and I realize we're looking for a project manager to manage the money, but this money was given to us, and I think Judy and Pete have done a great job identifying where the needs are. They've come up with a very structured program on how this money can be divided out, and I think we're going to be remiss if we're going to sit here the beginning of October and say we're going to wait to the 1st of January and then see some of these 633 entrepreneurial businesses go out of business, as well as the hotels. I think that's just wrong for us to do that. I think we should listen to what they're saying. They're in the trenches, and I think we should react.
Commissioner Buxton, then Commissioner Hall.
You sure? It's an ask.
Mm-hmm.
It's the public's going to be paying attention to what we're doing. They should. Love the program. I'm just going to throw it out there. What if we agree to $3 million, but the initial grant is $1.5 million, and you come back and tell us how it's going. We can tweak it. We can allocate the remaining funds. We can do whatever. So I'm just throwing it out there as a thought. It's a yes to the 3. It's an initial grant of 1.5 with a request to come back and talk to us about how, because yours is complex, right? Yours got a lot of stuff going on. Yours is a little more streamlined, right?
Basically, it's the same, though. They have to show a loss, and they have to turn in their profit loss statement and show the loss.
But he knows potential number coming in. You have no idea what's coming in.
No, we have no idea.
So I don't know. I don't want to complicate things. Yes to the program, yes to the immediacy of it. Is there any merit to saying that we allocate the first allocation of funds with a, we've done it with other projects. You know, county administrator petted the months. What are your thoughts on that idea?
Thank you, Commissioner Buxton. Well, it's a budget issue, and several months ago, I put out a draft budget as part of a presentation, and this is within keeping with that, the line for assistance to businesses that have suffered negative economic impact was $6 million out of the first half that we received. So it's in keeping with that. I don't think would be like a large sum grant to the chamber or to Kent County Tourism. I think, if I'm understanding correctly, the details would be worked out in some type of an application process. Applicants would be vetted through these agencies, similar to what we do with Delaware State Housing Authority, and once they're approved, they send the information to us, and then we pay the grant. Ultimately, because we're the recipient of the money, we're responsible for compliance and reporting back to the U.S. Treasury on every dollar we spend. So I think those details can be worked out. I think that's the way it would have to work operationally. You know, I've met with Judy and Pete. I think, you know, these are concepts that can be fleshed out. We can talk about upper ends if you want to have limits on the size of grants and that sort of thing, which may not be a bad idea, at least for the first round. You can do them in rounds. There's a number of ways to run grant programs.
Yeah.
And, you know, and I agree, this is, as the name implies, this is rescue funding.
Right.
And right now, we're not rescuing anybody.
That's right.
Except a bank it's sitting in a bank. And so the sooner we can get it out into the people's hands that need it, so better off. And it's meeting its mark that way. That's what it's intended to do.
So, short answer is it's really not needed to put out a 1.5 because there's already controls and we're going to have an understanding and.
They have everything into place.
There'd be some, lot to work out, but yeah, I think that's the way it should.
Commissioner Hall.
Thanks, Commissioner Angel. Yeah, to just follow up on that.
Can you speak into the mic, sir?
Sure. I think what we have here is, you know, some very well thought out proposals that could immediately help both communities. And I think if we wait for November 1st to get, you know, proposals in, and then we vet them into the month of November, and then we talk about bringing someone on the month of December, and so in January, I think we have enough information tonight to move forward. And although it's not a business meeting, I say we package this up and move it forward to a business meeting. I understand the idea of sort of going slow, but I don't know if it helps to give half the hotels half the money or all the hotels half the money. I mean, this is documentable, traced to economic damage. Nobody asked for this. It was imposed either by the state or federal government. And we're sitting on money, and we have been sitting on money, so we can't be accused of moving too fast, I don't think.
No.
I won't make that accusation. So now I'm saying let's move fast. Let's you know, trust the county administrator to work with you guys to come up with a policy and processes. And since it's all traceable and we are accountable to the federal government, I have no doubt that the county administrator will, you know, satisfy the business end of it while we bring on a project manager. But let's step out.
Commissioner Howe.
Yeah, just a comment. The money that we would give you is from the ARPA. Okay. If it were part of the regular budget, it wouldn't fly. But you mentioned as one example, some people can't even afford to pay their taxes. Well, it's projected by a variety of reliable sources that taxes are going to increase. All right? So you think people are having problems now. And my question is, what in the devil are we going to do then? Come up with another $2 million? The money might be depleted by then.
Well, I'm hoping that if we can help them, again, this is supposed to help them recover.
Right.
You know, I don't think that the businesses that are struggling right now have been businesses that have been struggling for years. They're struggling because of COVID. There is an exact incident that has happened to them, and they're saying, look, I can't make my ends meet. I went through everything I had. I went through all of my personal savings. I went through all of my business savings. I got the EIDL. I got the PPP, and everybody thought this was going to go on for 6 months. Well, here I am 18 months still, and I'm still in this. I still can't open up 100% because I don't have staff. And, you know, some of them, some of our restaurants in particular, you know, they made out pretty good during the warm weather months. But we've got cold weather months coming, so they're going to lose some of their outside capacity again. So what we're trying to do is help them get over this hump, get over it, because once they get over this, I mean, it's all of our hope that, you know, dare we say it, but by next spring, we're going to be back to normal, where people are going to be working and everybody's going to be back open 5 days a week instead of 3 days a week. You know, that's all of our hope. I mean, nobody has a crystal ball, but that's what we're all hoping for. But what we want now is something to give them the opportunity to get there.
Okay, well, you've done your homework, and I'm certainly sympathetic to what you're saying. I'm a totally committed capitalist. I want businesses to do well. I'm not a businessman, but I'm a capitalist. I understand all that stuff. I'm just looking at it from a different, deeper level, and that, you know, people are going out of business to some extent because the government is not relenting on taxes. And so the government gives us money to pay the taxes, and it just doesn't make sense. So the issue is much bigger than what we're talking about here. And if we got the $2 million in the ARPA, okay, I'm going to give it a try, but I'm extremely skeptical. Not of you, but of what is in the future. Okay.
Anybody else? Well, I just want to say thank you too, because we got to stop the bleeding, first of all. And to my commissioners here, if you remember back in July when I came back from Washington, I proposed an issue about looking at taking their returns and looking at it past year to show a loss. And Washington was actually saying that was a good idea, which is what you're saying. So because it's documentable, because it's verifiable, I think it's the right thing to do. It's the only thing to do that's safe and safeguarding, and we can't get called on the carpet for it because we're doing exactly what ARPA is asking us to do. So I'm definitely 100% willing to move forth.
The thing I see, for me personally, this is our first, essentially, other than the sewer one, this is the first one. It's going to go out there that, hey, we're getting this thing rolling. It seems to me that it's working in the order that it should, which is first the economy locally versus big ticket items. Anyway, so good.
But at least we got our foot moving forth in the right direction, which I think we should have done a few months ago myself, but, you know.
Absolutely. You were saying it all along.
So, yes, I was. But thank you.
Absolutely.
Anything else?
I'm just having fun, Alan.
So, no, I mean, we just need to work out the details with Mike as to how we can go through the grant process, and then we can get Falcasson in with us. If we have to bring Falcasson on board, we are going to need a little bit of help from the county to do that, because neither of us have the bandwidth in our budgets to pay them additional money. So it depends on what that looks like, whether or not we may need a little bit of a stipend to pay them, so that if they're going to be doing that record keeping, because again, neither of us have the bandwidth. I have 5 and he's got 3, so.
That can probably come out of the funds, right?
I would think so, and it would just be a pass-through. We would just, we would get a proposal from Falcasson for the actual cost, and we would just pass it through.
Because again, our intent is to make sure that this is as tight as possible. So literally, we want everything to be basically on a spreadsheet. So that way there's no question. Everybody knows exactly who got the money, how much they got, and when they received it, and then when they have to come back and present.
Yeah, another set of eyes with Falcasson during this whole process.
Mike, Kathy McGinnis had offered us the Gray Fox, which she would take over for the counties to keep an accounting process? I mean, no, we can pay for this, I understand, we pay through it. Is that something we should look at too? Because we're not going to be able to do this in a week, right?
Okay, there's two different questions there.
I know.
We're not going to be able to do this in a week now.
Good.
We can talk about the other one. We've talked about it before, but I thought back when it was first launched, there was a request for $100,000.
Right.
And Levy Court said no
Okay.
to that.
Correct.
I think that the state auditor continued with that program anyway. I know she also presented to the concept to the Delaware Association of Counties, you recall. And I don't believe any of the counties that I'm aware that they've signed on to it because they had other, things to understand about ARPA and how they were going to use it before they could agree to that. But I understand it's being utilized or somehow stood up in the on the internet. I haven't looked at it.
Okay. I just want to say that because it's, $100,000 paying into a system, we don't know what they're going to charge us yet. So I want to try and save money so we can get more money out to people. That's what I'm trying to say. So I want to make sure I look at both sides of that coin.
Well, that program that you referenced really was a transparency tool. It wasn't the accounting and reporting element. It was just a place where recipients of ARPA could report how they were using it, and it be out there for people to look at. But it really wasn't a CPA behind it or anything like that. This is what we're talking about, is something different, the accounting of it.
All right, thank you. Okay, President.
I've got to say this. If we're going to, if we're going to go down this road making people whole, I think low-hanging fruit with the fixed amount of money that's been lost, we need to take care of volunteer fire companies first. And they know how much they're in the hole, and they're volunteers work on a slim budget. So I think we need to put them right up there alongside this program to get them made whole. So,
Correct me if I'm wrong, they're in the hospitality.
not really. Their halls are,
Yes.
but a lot of money they raise goes to buying tires and oil and gas and all that kind of stuff. So, we need to make them whole.
Anybody else? Move forth on,
Great job.
Mike, when they talk to you, want to bring it back, or?
I think next step is for myself, Judy, and Pete to meet and begin to flesh it out and develop the application process and the checks and balances and reporting and the accounting, figure out what that looks like. I think we need to involve our finance department because they're going to be tracking it on our end, and all that needs to get sifted into the program. But we bring it back as soon as we can get it put together.
Okay. Commissioner Sweeney.
So you brought up Project Gray Fox. So Judy, the information that you provide to us that would lead to a check being cut out of the ARPA funds to a entity, is any information that they provide us confidential enough that it can't go onto a county website to show where we were spending the money?
I would have to defer that to Mike. I don't know. I can't answer that because I'm not.
The object of Project Gray Fox was transparency, not anything but just transparency. A one-stop shop for anybody out there to be able to go and say, what did City of Dover spend? What did Kent County spend? We're going to do the same thing. It's going to get public, but are we going to ask Kim and her group to set up an area on our website that we would be able to show every dollar spent and where it went?
We haven't even discussed that.
Okay.
I mean, we'll give it to you so you guys can do it, but I don't know what the role is.
I will say this, though, anything that we do is FOIA-able, so it would be subject to Freedom of Information Act, whether we put it on a website or we have it in a file here, it would be accessible and visible to the public.
Commissioner Buxton?
Leadership, right, should address the comment that was made, because I don't believe your program speaks directly to the volunteer fire companies other than their
Hall.
So my comment, rather than let that go, is to say, okay, what's the next steps there? I can work on that. You can too, what the next steps are, and I don't think that necessarily is in their arena.
They already have their fund,
Right.
their paperwork, and it's already documented through the state, how much money that they've lost. So,
Right.
and, their funds not only come through the rental of the hall, but private donations, solicitations, and all that kind of stuff, and that's the money that this isn't going to cover.
Sounds good to me, yes.
I guess the biggest question is, how soon can you get back to us?
Well, as soon as we can meet with Mike, because we're ready to roll, because we got people out there who are in desperate need.
I just wanted on midnight dates. So we can't get called on the carpet. So. No further questions? Well, thank you very much.
Thank you.
We'll hear from you
Thank
soon.
you all very
Thank
much.
you.
Thank you.
Thanks, Judy.
Thank you.
Thank you so much.
Judy, congratulations on your retirement.
Thank you so much.
Here, here. Okay, video conferencing upgrades, Kim?
And that's
Hey.
what I want to do.
I understand was they were included in it. Basically, submission that they made to the state that
guarantee that.
included their.
You need to be recommended.
Next thing I want is parking.
Good evening, Commissioners. I'm here to talk about 3 topics, and the first topic is audio-visual conferencing. As you know, about a year and a half ago, we did upgrade our AV equipment in this room, as well as 220, 221, and caucus. And Mark Kennedy, our media coordinator, has taken the lead on this project. And obviously, due to COVID, we've had to change our accommodations for our meeting rooms and how we go about having those meetings and renting out the rooms. And room 220 and 221 does not have the functionality to provide the remote meetings because it doesn't have mics. The only mic that has is in 220 and you need to be at the podium for the other folks to hear you. So we'd like to outfit those rooms with mics, as well as in this room, when we have someone doing a presentation and they want to do annotations, they can't do it from the podium. So we'd like to put that functionality in. And with that, I really want to turn it over to Mark, because Mark's been working with TVP, the vendor, and who is now called RTS Solutions. And if Mark, if you'd like to talk over the functionality and a little bit about the costing, and we can also talk about the funding source as well.
Sure, thanks, Kim. Forgive me for having to do triple duty here. I have Tom and then watching the WebEx. So just really quickly, what we wanted to do was, as Kim mentioned, with COVID, the way the world communicates now is different. So we're now more reliant upon virtual technologies. And Kent County has been able to provide virtual meetings. I mean, we have people right now online participating and listening to what's going on here. So what we wanted to do was to provide those capabilities in our other 2 meeting rooms, mainly 220 and 221. So that would require us to add microphones, which would be in the ceiling. And so it would pick up everyone in the room rather than having to give anyone an individual mic. It will also install cameras in the room, 1 in room 221 and 2 in room 220, since it's a larger room. And the programming to go along with that so that we can provide a hybrid meeting in the event that you wanted to host some people in and then have, like we do here, people online and then be able to communicate back and forth both in the meeting room and those who will be participating online. And as Kim mentioned, we would be adding a annotation monitor at this podium right here. And the benefit of that is that right now, if someone wanted to, let's say, point to something on a screen, like if we were viewing a map, the participants online will not be able to see that. In the room, they would, because they can catch the laser pointer. By adding the annotation monitor there, a participant can come, make an annotation to a map, and then they will also see that annotation also on the WebEx as well. We also will be adding a feature, this is primarily for like the RPC meetings, where some constituents are coming in with their own devices. They would like to share maybe a picture or a video that they took, but they can't hook into the system. So we would have a wireless puck, which we would give them, and they can wirelessly project onto the screen and as well as into the WebEx, just giving us a little bit more functionality and providing a little bit more accessibility for them to interact with our system back and forth, both with those in the room and those online. So I'll be happy to take any more questions that you may have. I don't want to bore you with technical details, but just wanted to highlight a few of the areas.
Any questions for Mark?
If I could just add, Mark, if you already covered this, I apologize, I was sleeping. In room 220, we're going to be adding cameras, which will enable, like we have in the caucus room, to be fully two-way video capable. We have a lot of organizations that use those rooms, who like to use those rooms, and since the things have gotten somewhat better, the first major event that we had was on September 1st, where the Greater Kent Committee had their monthly meeting at our building, and we were able to, we kind of came up with a solution using a tablet and a tripod and all sorts of things, but we don't have a camera in that room, so we used a portable laptop to do that. But this would bring that room so much more usable for video conferencing than it currently is, and I think that would be a great benefit, not just to us, but to our guests that use that room as well. And that's all. Thank you.
And just to piggyback off of what Mike just said, we've been kind of doing patchwork with our systems in the sense that when we finalized the design and the installation, this was pre-COVID. So we built a lot of backbone in the technology and into our network, which has allowed us to be able to function seamlessly right now. But but this upgrade will make everything function the way it really supposed to. So right now, what we're doing is we are broadcasting on WebEx hybridly, in the sense that we're on the phone as well as we're sending a video. So when we finalize the upgrade, we will be able to send audio and video through one computer, and we can use the phone as a backup system rather than it being our main system. So right now, if our VoIP was to go down, then the WebEx would go down. So we were just making these minor little tweaks to really have it function the way it should function going forward. So,
Thank you, Mark.
Mr. Maston, do you have a question?
No.
Okay, sorry. Thank you, Mark.
So to further state, this is a sole source purchase from RTS Solutions, formerly known as Total Video Products. Total Video Products currently has our maintenance contract, and the total enhancement cost is $45,309. And the funding source that's being recommended is the audiovisual replacement project out of capital projects, which is actually money that was left over from the actual AV upgrade project.
right.
Okay.
Like that.
Okay, the next topic is, oh, sorry.
Are we moving that forward to consent?
I was going to do it all at one time. Since we want to do it, move.
Do them individually.
Yeah. Okay. Move it forward to the next meeting. 7 up. Thank you.
Consent agenda?
Consent.
Okay, the next item is Central Square Technologies. This is a routine annual maintenance that we pretty much come every year asking for authorization. Central Square Technologies, formerly known as Superion, provides our software and for our software for parcel management, building permits, code enforcement, sewer permits, cash receipts, and tax billing and collections. And so the maintenance date for this software is October the 1st, 2021 through September 30th, 2022. The maintenance does include software upgrades as well as technical support. And the funding source is FY22 General Fund operating budget for the Finance Department as well as planning. The maintenance coverage is $36,442.80. Be happy to answer any questions.
Any questions? Okay. Move it forward to the business meeting. 7 up. Thank
Okay.
you.
Thank you.
Next one.
Yeah.
Consent.
The next item is, I was here on August the 10th, and then you all decided on August the 17th that the county was authorized to move forward with an ERP software solution with Tyler Technologies. And so currently we're in negotiations with Tyler, talking about the costing as well as implementation. And one of the things that they've offered us is two solutions. One is a hosted solution, which they call software as a service, and the other is to purchase the software and bring it on site. And so in your packet, I did put together a little chart that I'd like to go over. Tyler Software as a Service provides the software licenses, all the hardware. Tyler assumes the risk of data security, infrastructure, cybersecurity type thing. And they feel they can get the hardware up and running in 1 to 3 days because they already have it on site. The county data would be stored at the Tyler's remote location. Software upgrades are included in software as a service. County staff would access the service through internet. And Tyler provides a 24-hour, 7-day-a-week support. And this solution would require minimum county IT resources. And this is offered to the county at $309,809 annually. Now, the gray area that's in there, I didn't really want to talk about, but I did put it in there just as a reference in case you had any questions on that. But this is Tyler Software as a Service, where they pretty much provide everything from the software to the hardware. They assume the risk, and they provide IT resources for that annual price. The other option is on-premise. And on-premise, the county would purchase the licenses, which is a one-time purchase. The county would then purchase the hardware, which is estimated to be about $125,000. The county would assume the risk of data security and infrastructure. Obviously, we'd follow the procurement process, getting quotes and having the equipment installed. Could take us about 3 to 4 weeks. The county data would be stored on site. Software upgrades are included, just as it is in software as a service. The employees would use the county network to actually access this software. And the support, technical support, would be the county IT resources, as well as Tyler as a backup. And this on-premise purchase would require dedicated county IT resources. And the cost comes in about $115,614. Now, the optional price there of $43,853 is for Tyler system management support, which means they offer that for most organizations that are small that may not have their own IT department. So that is offered as an optional price. In your pack, go ahead. I'm sorry.
There's
Mr. Buffalo.
multiple.
Okay.
There's multiple organizations that are using Tyler. You had any feedback from them on what they do?
Yes, we talked to Newcastle County, and they are using software as a service. City of Dover and Sussex County decided to purchase it and bring it on premise.
Excuse generalized numbers. It's $1 million for on-premise. We went off-premise. It's 700,000 basically. One time.
You're looking at the purchase price, the gray area?
Big cost, right? The first
Yeah, we're still negotiating that particular piece, but yes, there is a Tyler service for data conversion and implementation, and
we can't avoid it.
no.
If it comes in at 600 or 780,000, you're gonna have to pay it. So let's just use your number. It's 700,000, where it's $1 million if we do it on our own. So it's
Actually, that's the purchase of the software. What we were talking about tonight was software as a service on premise, which is the yellow area, the annual reoccurring cost.
correct.
I'd like to come back and talk about the one-time cost with the county after we get it negotiated. That's why I put it in gray, just, it's there, but tonight's conversation mainly is,
I'm sorry. What are we deciding? The 309?
We're deciding
or
whether-
or not it's 115 or 43.
we're deciding if we would like to have Tyler host it as software as a service for $309,809 versus purchasing the software, purchasing the hardware, and bringing it on site for an annual cost of $115,614.
But that's why I mentioned what I mentioned. It's 300,000 more to bring it on site, and you pay yourself back within a year and some change time, if I do the math correctly. If you host it, if we keep it. So it's a greater expense initially,
Yes, it is a greater expense initially. That's
but
correct.
it's a very quick payback.
For 2 years, you've paid it back.
You've virtually paid it all back, if not more. And if you utilize the 43,000.
Commissioner Sweeney?
So is there a, I didn't read, go ahead. Never mind, go ahead, Commissioner Sweeney.
So Kim, your professional opinion, what's your advice to us?
Well, I know that with regards to software as a service, organizations who, software as a service is very enticing for the security aspect of it and the hardware costs because you wouldn't have to incur that. But the county does not have dedicated cybersecurity group on staff, but we do partner with CISA, which is Cybersecurity Infrastructure Security Agent, who is the nation's risk advisor to the United States federal agency, and they operate under the Department of Homeland Security. We also partner with MSISAC, which is the Multi-State Information Sharing and Analysis Center. And we also work with the DTI, Department at the state of Delaware, the Director of Risk Management. And currently, we're working with DTI through a grant fund to put in place an intrusion detection monitoring system. So even though software as a service is sold because they have a security group, I feel that Kent County does a pretty good job of that as well.
Right.
And so not only do we have partner with the largest security agencies, we also have virus protection on our firewall. We run virus protection software on all the workstations, and obviously users need to have authorization to sign on to our network. And even with all that, the biggest threat is staff. I hate to say that, don't mean to say that, but they unknowingly may open an email or unknowingly go out to the website and download something that could be a virus.
And that could impact us whether we host it or if it's SAS.
That's correct.
Either way, doesn't matter. So as far as your staff, are you comfortable that you have the staff to support any hardware that we bring in place to support it on premise?
Yes, I mean, that's pretty much what we've been doing for the last years. We typically do purchase the hardware and bring it on staff. The county staff is proven to support the core business systems, which is what this Tyler is recommending to replace. We currently have the infrastructure in place. Obviously, there will be additional hardware because this is a very large ERP system. It has your financials, it has your personnel, it has your payroll, it has budgeting, tax billing. It's very, very encompassing. And we do work with the top agency security officers. And so unless there's something else that I may not be aware of that may be in process of reducing the footprint, my recommendation would be to utilize the staff that you have today and the infrastructure that you have today and purchase it and bring it on site.
Thanks. So our pipeline to the internet right now, how big is it?
We have 100 meg in this building.
100 meg. And are we, are you able to see what kind of bandwidth we're using on that?
We use about 50%.
So we use about 50%. If we go to a cloud offered scenario, which is SaaS, is there a chance that we're going to have to increase that to 1 gig?
Most likely, I mean, because at that point you're doing all your core business processing over the internet.
Right, and those costs are not included in anything that you're putting in here.
That is correct.
All right, thank you.
Okay, well, I see this differently, gentlemen and ladies. Just hold on a second, Mr. Hall.
Sure.
On premise, we have great staff. There's no doubt about that. However, when you look at the dollars and cents of this side by side, the licenses are included for both, but there's one time for on-premise. All hardware is included. The county purchases it. If anything happens to it, we have to pay for anything to be fixed. The data security, which I've been harping on for years, the Tyler assumes the risk. County assumes the risk if we go with on-premises. I've asked about our insurance company if it's something should happen to it, would we be covered? Because that's what happened to the small town I reported to you about that didn't do it right, and the insurance company dropped them. Service implementation, 3 days compared to 3 to 4 weeks. Data repository, county data will be stored at Tyler's, which is a cloud, which is safe. So far, nobody's been able to break into that. County data will be located on premises. That's another staff issue. If something happens, we're having a hard time finding people to get in our IT department right now. Software upgrades, always included in both. Internet access is our easiest way to get in. County network goes down quite frequently, so there's an issue there. Technical resources, Tyler responds 24/7. We have thousands of people in place of just a small staff of ours. They can get on here at any moment of time to fix a problem, get things taken care of, instead of tying up our staff to do what they have to do and continue to do their record jobs on top of it. So, I see this as the best way to do this over time is the software as a service. Having talked to Newcastle County, the IT person up there, he definitely recommended us go with the service. That's what he's recommending. And he's been in the business a lot longer than I have been. I've done all the courses. I've done my homework. I've even talked to Mr. Pettimage. And at this time, I'd like to have Mr. Pettimage give me his 2 cents.
Okay. Well, thank you, Commissioner. I believe that, and I'm going to disagree with staff here, that the cloud-based solution is the superior choice. And I would just urge the commissioners not to base this solely on price. Do not make that mistake this time. Yeah, looking at it, 300,000, but it's a predictable annual cost that we can budget for. We as a group have been saying for a long time we want to advance our technologies. We do not want to run in place or be status quo. If you look at the industry and the government sector particularly, the rapid growth in movement is toward cloud-based technologies. And the reason that is it's predictable. It doesn't require the mountain of capital dollars when things have to be refreshed that we sometimes struggle to generate and have to plan over the course of many years. So we suffer every time someone in a higher level technology position leaves the county, and we've had that movement. This is a highly dynamic industry. People move, and we've gone over a full year without a network administrator. Now we finally filled it with in-house personnel promoted, which is great. But the issue for us is we struggle to be competitive in the hiring sphere. We try to get the best candidates, and we just experienced this recently with another position, IT, where we could not bring in people that we, because of the cost, and we're going to struggle with that moving forward if we continue to have to rely on the upper echelon people to run the system when someone leaves. But the biggest aspect for me, and the thing that put it over the top for me, is the cybersecurity aspect. We have tools in place, there's no doubt about it, but I think we are still vulnerable. And with the cloud-based solution, you're buying into a 24-hour, 7-day-a-week, 365-day-a-year dedicated group, deep bench group of people that are constantly fighting the cyber warfare that's going on out there. You got good defenses here. And that is the number one reason the people who offer these products are seeing growth in the cloud-based the migration to cloud-based solutions is the security aspect of it. That is the number one reason that people like us are moving that way. And it only takes one major bomb to go off, so to speak, not a physical bomb, but a ransom attack or something like that, to realize how vulnerable you are. And with the cloud solution, not only do you have that security aspect, but you've got substantial redundancy in the system. It's built in, which we don't necessarily have right now. If a major system fails here, where does it kick over to? With the Tyler cloud-based solution, you've got multiple places where they can bring you back up and run from a different location if there's a problem in one location. So for all those reasons, and we did spend a good bit of time talking with our colleagues up in Newcastle County about this, and after that conversation, unequivocally, I think the cloud-based solution is the way to go. It's a great insurance policy for the county, and I think we can't go wrong, and we would be making major steps forward with respect to our technology. So thank you.
Mr. Buckland?
First of all, cloud, Ellen Angel.
Been pushing for it for years.
Huh? I thought you didn't like the cloud.
No.
They stole stuff from the cloud.
No.
Not really. Kim, and I respect your thoughts. You really sold on the opposite direction, or are you just giving us some thoughts?
Well, obviously, we could go with whatever direction is decided.
Are you sold on the opposite one?
I am, and here's why. I worked at private industry for years. A lot of staff that you have on staff has worked in private industry. When you start talking outsourcing, when you start talking hosting, that means their job goes away. That's just how we're bred. You know, when you've been in the business for a number of years, that's how they think. And they're going to start looking. And you kind of need them to get to where you want to go. And Tyler says you can outsource it at any time. I think it's important to keep your staff intact that's there now to get you to where you want to go. If that staff then retires or moves on, you then can think about moving it to the cloud. Now, with respect to using the county network or using the internet, well, they kind of both can go down at any point in time. As far as replacing hardware, we budget that. No disrespect, just this is my thoughts. So obviously we could work with whatever direction you decide to go in. I would strongly consider that it does send a message to your staff.
I don't know if I...
Commissioner Hall, I'm sorry, Mr.
Thanks.
Pesman.
Two things, which Mike sort of touched on, which was continuity of operations. We're a low-level county. We had our own personal tornado here not too long ago. So although acquiring the hardware and setting it up here locally in the building, having that much data for disaster recovery means that we also have to have all that mirrored somewhere else, hosted somewhere else, which is a service.
Which is what we do today. Mm-hmm.
Right, so if we go with software as a service, then that's just sort of baked into that pie. The other part of that is what I didn't see in the timeline was I saw 3 to 4 weeks to set up hardware, but integrating legacy systems into an ERP system, I think, is the only form of torture not outlawed by the Geneva Convention. But, I mean, you don't have to look too far into the IT world to see that ERP implementations are painful. So, you know, so you get the hardware, you set it up, you get the software, you get it set up, and then you have to begin mapping your financials, mapping your personnel, mapping all of our existing systems into that system, which takes personnel time, and then you have to start wiring them together. So that's what we're taking on, right? Because it's not like we buy an iPad and it sits in the corner. I mean, we're talking about integrating our systems into something newer, being able to access it, and that's great, but that's... So what staff is going to be doing all this data integration, and what's the timeline for us to build our own ERP system?
Right. Now, obviously, our staff would have to export it out and work with Tyler to have it remapped into their system. So that is an undertaking. As far as a timeline, that's something that we currently are working on with Tyler. We are also working on getting a project manager for this project. We're real close to having a project manager to help us negotiate this contract and timeline, as well as the work that's required. So I would come back with that information. Tonight, just wanted to try to get an idea of, does the county want to use software as a service, or do they want to bring it on premise? So then we can go back to Tyler to say, this is our preference, and then we can get further quotes.
Okay.
Commissioner Howell.
Yeah, when do we have to make a decision on this?
Excuse me? I'm sorry.
When do we have to make a decision on this?
Soon.
Now.
We have to pretty much do it now? It's clear as mud to me. I'm sorry. I have to sit back and listen to the experts. Whatever you guys want to do, hey.
Commissioner Masson and Mr. Pettimaj.
Go ahead.
I just wanted to follow up on something Commissioner Hall said, and that is the data mapping, the conversion, all that, the workflow mapping. That has to happen whether we go with the on-premise or the software as a service, and that's a monumental effort, and it's the bulk of the time spent with Tyler will be doing all that work, and to be staff hours totally dedicated to working with them and with the project manager and with the change manager that we'll bring on to get there. But we're at a fork in the road right now in the negotiations with Tyler because, we want to wrap up a contract, and it has to either be based on the cloud-based solution or the on-prem solution, and then we can forge ahead. So we're kind of at that moment, and so I'll stop there.
Mr. Buxton?
In the short term, I'm still at a loss for how this is, and it's because I'm ignorant to it. How is this offensive to the staff?
Well, if you decide to outsource it, then, you've got 3 staff members right now whose full-time job is to support the systems that you will then be outsourcing.
So then they would not have a role, or they would now expand to other areas?
Well, that is what would need to be determined.
Vision they would have another role, that we wouldn't be talking about furloughing or...
Absolutely not talking about laying off anybody. I think we have a small and very busy staff now that, from my accounts, and I think what Kim would also say is sometimes they are stretched thin. And sometimes, things that take us longer to get done because we have a limited staff. There are things that our staff, I think, will be doing moving forward. There's no plan to lay off people. That's not what this is about, in my mind anyway. It's more about the things I hit on, and that's security, our competitiveness, the predictability and reliability of the system, the natural disaster type of scenario. It doesn't have to be a cyber attack. It could be a hurricane.
Yeah,
tears this building up and we're down for 4 months or something like that.
And they're
So I think you're getting a lot of that, as he said, baked into the pie with the cloud-based solution.
I'm almost done, but Kim, you were getting ready to say something.
Oh, I just wanted to say that they're very different skill set. Mike has a good point. Networking, that's one skill set. What I was speaking to is you have 3 dedicated business analysts who would still help support the systems remotely, but at the same point in time, today, they work on managing the AS400 and 2 other programmers underneath them. And so that's a very different skill set, and they would need to be retrained to work on a new platform. They just wouldn't have the responsibility to manage that in-house, manage the data in-house, manage the hardware in-house, do the software upgrades. It does take a big chunk of their data and offloads it.
So, but I'm almost done. This is I respect that. I appreciate the fact they have value in what they're doing. If we made this move, it doesn't devalue their role at the county. It just changes their role slightly. It makes them more useful in other arenas, potentially.
Potentially.
Yeah. Well, not even potentially. It would, because they're not in that arena, I guess. So we'd have to. Anyway.
Okay. Well, first of all, we got to get rid of the 400. It's antiquated. We all know that.
Can we poll the audience right now?
Well, just hold on a second. Just hold on a second. So, even when I brought cloud up when it first came out, I was told that it gets rid of people. Well, that's not 100% true, because a lot of IT departments have added people because of functions and other duties. The fact is, we wouldn't be talking about this today when we brought up about doing an RFI, looking into it. We were told 7 to 9 months to get that done. Mike got it done in 7 weeks. That's why it's here now. So we need to move forth. We got to look ahead of ourselves, not look behind. We've already done behind. We need to look to the future. The future is what we're looking at now to move forth. I'm sorry I'm going against Kim's wishes, but you have to argue, and she does her job well. She argues her point. But at the same time, that's the problem. You get stuck in our same old, same old. We got to move on. We have people that have been here for years. That all they see is what's in front of them. They don't want to do anything new. They want to have something, and they may want to have something controlled to this, which I have talked to Tyler on this as well as Newcastle. If we do premise and they ask for an upgrade or something else done by the premise, it's going to cost us more money, and we don't want to do that. We want to fit to their needs, not have them fit our needs to them. So that's why I'm definitely more in favor of staying with the cloud moving forth. As Mr. Pettimage has stated, and as I stated, and as I've been saying for years, this is the way to go for the future. It's the way people are going. Right now, it's going to cost a little bit more, but what doesn't when you do something? It will get better. Plus, if something's down, we're covered. We don't have to worry about what's it going to cost us. When it, anyway.
I want to say clearly, I don't agree with you. I don't think their staff's holding us up. I think we're moving forward as fast as we can. They're going to accept whatever role we.
Well, you weren't here when the conversation took place about how long it was going to take.
I wasn't here. I was here, though, 2-3 years ago. I was here every time we tried to get it implemented. Here's my point. I'll end with this, right? If they have to accept the role, they can. I'm glad that we're moving forward. Let's poll the audience, right? Or we can keep, if it's tied, I'll break the tie. I can absolutely break the tie right now. I know how to break
I would
it.
like to offer up Donna Barnes, who's here. She's your business analyst for these systems that would be replaced. Donna is in charge of the AS400 and all the systems that run on the AS400. Donna, did you want to weigh in and say anything with regards to hosting versus on-prem? And again, as I've said, we'll work with whatever is decided. Just wanted to lay out some suggestions.
Well, this does change exactly. It changes everything about how I would look at my future here. If you have it off-site and the data is controlled there, FOIA requests, any requests from in-house, all of that stuff would not be handled with us who have access to the data live to do it because it's on site. We would have to send that request or any requests off to Tyler, who has staff, but they also have priorities to get these things done.
Donna, I need to ask you that question because you said who's going to request that? Somebody from the county is going to request that information. So, I mean, it's not in suspended animation. Somebody's got to put it in to get that information.
Right.
So it's got to come from the county.
FOIA requests
happen.
They come from outside.
So it's going to position is going to change slightly. I understand that.
But we would not. Your staff here that you currently have invested in would not be the ones to gather that data, to do the analysis on that data, to get it back to whomever is asking for it. That would be off-site. That would be with the people who work for Tyler. It wouldn't be the people who work for you, which is why I thought way back in 2007 you guys brought the IT staff from being outsourced or being with a consulting company to have that staff here and have that all of that investment. We've invested in the network, we've invested in GIS, we've invested in .NET with Patriot and SQL. I would have to, and I'm not unwilling at all, none of the people who work for me are unwilling to learn what we would need to get done to make Tyler work on site, where we have access to it, where we write the code, where we write the queries that pull out the data to do business analysis. But we need to know that you're invested in us. My systems are going away. I'm not against that, because that is where the county wants to go. I'm willing to learn everything that I need to learn and use the business analysis that I have built over the last 15 years here and just learn new code. People learn new code all the time.
Either way, though, right? Because it's still got a new system.
I would be involved in the implementation, but once you get that on site and the implementation is done, what do you have planned for me? Or the two people that work under me? Where if it's on site, and you always have the option of moving it off site in the future. Tyler has said it's a fairly simple process. It's their block of data. They know how to pick it up and move it. If we all retired or got hit by the same bus and there was an emergency, they can pull it out in days. But we would all like to know that you are invested in us, because we are giving up everything that we know to move forward with new technology, and, you know, and that's fine.
With
I'm
managing
more
the
than happy
data
to do it.
and backup, you know,
We've been doing that for
redundancy,
years.
those type things.
Off-site backups, with, like currently with our I-Series, if it were to go down or the building got blown up, we could be backup, because we have those worked into our backup disaster recovery plans. That's a whole, you know, that stuff is covered. It's stuff we do now. So I just need you to know that. We would be concerned.
But you also mentioned if the staff got hit, or COVID or whatever, we'd still be down. We can't get people now to do it. Right now, we have Tyler, which thousands of people that could fill in to help out.
But why are you not getting staff that you need? Because of
We
salary?
can't find them, first of all, so that's part of
Salary's
the
a
problem.
big one, but you're gonna spend $200,000 extra per year, or $250,000 per year to have them do it, where for an extra, what was the difference for the last guy, 10,000, 15,000? For him to accept it, the GIS guy?
Yeah, it was
What
up
was
there.
the little bit of money that he needed to come here and bring us all of his expertise? But we're willing to spend $200,000 or $300,000 a year to have Tyler. That, to me, seems like your vision is, let's just keep paying these people that are outside of here and not pay your own people or invest in your own people.
But what you're saying now is, we could go with cloud anytime. But what you're just now saying is, we won't go with cloud because of that attitude. We won't go that way because that's the same attitude you're going to give. If we don't change now, we won't change.
But we are changing. You're bringing in more modern technology. You're bringing in a different way of presenting data. It's all internet-based. But you're investing in your staff, too, by saying, we will be the ones to control that data. I don't know why you still have that moving forward.
I guess you need to talk to the people in Newcastle, because they have added people. They haven't gotten rid of Tyler. They've added. I just came back from Washington. I was there with Tyler and Open Government. I talked to them all. Everybody that has this system that's going cloud is not diminishing their staff. They're increasing their staff. So I don't understand.
I guess that's a possibility, but Sussex and Dover also kept it on site. They had to have very good reasons for doing that. But I don't know why it's so important to get it off-site at this time.
Because, well, I guess I'll go with security. That's the number one thing, security-wise. And plus, if we go down, we're covered. We're up and running. We got somebody that can come in with thousands of different people across this country to fix whatever we got to, instead of a small group of IT that's already overstaffed or understaffed to do the problem.
And that tells us a lot, just how you say that. It tells us as a staff a lot on how you...
I'm not making it derogatory. Look how many times it's gone down, and you guys had to come in, Friday, Saturday, Sunday to get the system up and running?
There's different aspects of the system.
But it's still an aspect. It went down. We have that with Tyler that could fix it also with their knowledge. So it gives you guys more time to do your regular job instead of have to go back and try and fix something else. I guess I see it totally different from you.
That's true. Okay.
That's the only way I can say it.
That's
All I
fair.
can say is we just put in video cameras and everything here upgrade. We just did it. Things change quick. And we're putting money into it to make it better. That's all I'm trying to say. We're making it better. And I believe what the county administrators just said, and what I'm saying, is the way we need to go towards the cloud. It does not have to do nothing to do with getting rid of staff or making them feel uncomfortable. That's not the point. It's because the AS400, it's so antiquated. Like I said,
But it works.
Either way, you're going to go away from the AS400. I mean,
Right, I mean,
either way.
that's going to happen. I mean, that's,
yeah, it should happen years ago. Yeah, I agree.
I don't know,
So-
it's pretty reliable.
I mean, that's a whole different ballgame.
I am ill-prepared. I'm now better educated, but I'm completely ill-prepared on this conversation. You have the benefit, I assume you do, and that's not your fault, of knowing this was coming, right? The question I have is twofold. If we're making a decision this minute, right, the only thing that I care about is this county, it's not the only thing, the biggest thing I care about is this county implementing Tyler to its most effective usage so that we become, I use the term, modernized. Does that in any way get diminished if we choose this position versus this position, other than security? Other than security, is there an obvious one? Commissioner Sweeney, your thoughts are most likely not.
No, they don't. Not with either of the choices, and even with security, you probably are more at risk if you put it in the cloud, only because someone who is trying to get access to that data is not going to look at the single point of service. They're going to look at the big cloud providers. They don't come after my business because we use Amazon. They go after Amazon because Amazon has all the business information in one place.
I guess a good answer. I didn't ask the question right. I just mean day to day. In either direction, it's going to work well for the most part. In either direction, it's going to work well.
Same functionality, yes.
It's going to work great. That's worried. We're only worried about when it hits the fan, right? The decisions we're making tonight are about if it hits the fan.
If it hits the fan, if it's continuity is a big issue.
Yeah.
Munis itself is a big issue. I totally disagree with what Donna's saying about she's going to somehow lose control over the data. Well, there's a problem right there when I hear I control the data. Look, data in, data out. I mean, whether it's here or somewhere. Right now, they have to run programs in order to extract stuff out of this dinosaur system we have. Okay? And that will go away.
But that goes away in either direction.
That goes away, yeah.
Yes.
And so what we're talking about here, and I think what sells me on the cloud is the reliability, the redundancy, the security aspects, and I'll say it again, the difficulty we have in hiring top IT people. We got to face that fact. That is a fact. Okay? And anyone who says it isn't, they're not being truthful. We just experienced it. It took 3 months to fill a position. I don't want to go any further than that here, but I'll talk to you offline about it. It's a very dynamic industry, and if we're trying to bring in top talent, we're not going to be in the game. But we are if we go cloud-based, because you know what? Tyler has the top talent. Right. And that is not a criticism of anybody on staff. I'm just saying they know how to run their system. They got a deep bench. They got 4,000 employees that do this stuff. So,
Jeez, pizza.
Mr. Hall.
Because to that point, we're having a conversation tonight about software on site or software as a service. But 5 months from now, we'll be talking about how we can't afford pay and benefits because of the footprint that it's going to put on the budget. I've watched it 3 years in a row. We can't afford this position. We can't afford that position. I don't know how many critical positions we have between public works and other staffs that never get filled, or it's like pulling teeth to find people to come in and work for the amount of pay that we pay. Because when we're talking about these critical positions, whether it's a professional engineer or somebody in IT or somebody at GIS, they can go somewhere else in private industry and make more than we can offer, and in budget season, more than we're willing to offer. So when I sit here and think about this, I know that we'll be coming around and having an entirely different conversation a few months from now saying, we can't afford a pay raise, we can't afford steps, we can't afford this, and we can't afford that. And that translates into finding talent and bringing talent in. It's all related, but we have independent conversations as if they're not. So that's my concern. I agree with Mike, is that Tyler can pull in top talent, keep top talent on staff, and that's a different situation that we have here for the amount of money that we operate on. I'm done. I vote for software as a service. I hope we vote.
I haven't been here obviously as long as the rest of you, but I sat through the last budget season, and I've talked to Kim before when she was trying to get a network administrator. We went to the next level of Indeed. We went on and on and on. Had a conversation this week with someone in another area of the county where there's a huge deficit of people. You know, well, look at the rates that Newcastle's County's paying, look at what PA's paying. It's the same story time after time, and I'm sure I'm going to experience again next budget cycle. They're going to need people, and we don't have the money to pay it. So, You know, I went through the pain of the AS400 to the SAP system several years ago, and I will tell you, we did it in-house, and I will tell you, it was paying $750,000 above budget just on overtime. You know, I still think for all the reasons we've talked about, the cloud, et cetera, you know, we're better off to go with a taller SaaS system and call it a day. But it certainly does not minimize my feeling about what current staff is, because I think the county has the best of the best. And I know they know their jobs, but again, budget time, it's gonna be the same dog and pony show.
So-
No money and X amount of spots.
Agreed now, but I will defend the county and the county taxpayer by stating that we fully implemented a pay study after giving 2% steps and 2% COLA. So I don't think we're kicking anything down the road, in fairness. If we want to have that conversation, it's fine, but for you to state that me articulating concerns about costs at a table that's not fixed on something, I don't know if that's fair. You know, so I mean,
It may not be
6%.
fair, Commissioner Buxton, but it's the reality of the situation we have.
Okay, it's fine. I didn't hear that stated at the budget. That's okay. I heard 6%, which is a pretty good raise. Is that on average what some people were feeling, right? When they got the pay study done and, you know. So I hear everybody stating that the one on the right's the one to go with, right? Yeah?
What's that?
The on-premise, or no, the other one, the middle one.
The service.
The Tyler service.
I don't know. Yeah, that's the one you guys are leaning towards, or all in on?
I am.
I am.
All right.
So, are we finished talking?
I need Jeff to repeat everything he said because he wasn't talking in the microphone anymore.
Another smart.
I said, software as a service, time to vote.
I second that.
Okay, show of hands to move the software in as a service.
Let's go to a business meeting.
Yeah, if it would go to a business meeting, either as a consent item or as a item for new business. It doesn't appear that we have unanimous consent.
It'll go new business. I'll have a conversation. That time.
So, go show hands?
Show of hands for service
To move it to where?
Move it to new business
To the
next
cloud.
week.
next week.
As opposed to consent?
Not consent, correct. New business.
Whatever.
Okay, 5-2. Okay.
So,
We'll need a motion for next week.
Yeah, we will.
for the only purpose that I can keep alive a conversation, I came in unprepared. Clearly, you guys did your homework on that one. I didn't see it.
Oh, I didn't do my homework. I've just been doing
You're
this
aware.
for 40 freaking
He is the
years.
homework.
That's second nature for you.
Yeah.
No worries.
Okay,
Say
that's the
no
last
for or
item.
against it.
Any public comments on these 7 items? Anybody online?
We do have someone online, but I don't believe they want to participate at this time.
Okay. Mr. President, back to you, sir.
Okay, no further comments? No further agenda?
Move to adjourn.
No executive session?
No. What happened to you?
Huh?
What happened to you?
We turned into Mr. Peanut.
No. No, they cut my leg. Did surgery on my knee last week. So.
I know.
Meniscus.
Meniscus.
Yeah, when I had mine done, I didn't use a cane. But
What do you want?
they're very handy, you know, when you're feeding little children.
Skill set is still valuable because you understand how it works.
One's this.
Well, it wasn't that. It was
Oh.
they drilled a hole in my bone and injected some stuff.
I'm flabbergasted.